In accordance with Executive Order N-08-21, the Humboldt County Board of Supervisors meetings are being held virtually. You can participate via the Zoom call-in phone number, which is located on your screen and on the front of the agenda. So at this time, Tracy, will you please do roll call?
Yes. Supervisor Madrone.
Here.
Supervisor Wilson.
Yes.
Supervisor Bass.
Yes.
Supervisor Bushnell. Supervisor Bohn. Everyone's present.
All right, thank you very much. So at this time, we'll go for the flag salute. And Tracy, wow, you're totally got it all covered today. Right. We got lots of flags, actually. All right. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. Now, we have a very patriotic group this morning. All right, so if you haven't been on, especially this morning, how's that? If you haven't been on these meetings for a while, just to give you a heads up how this goes. For those of you who would like to call in and make comment, please raise your hand by pressing *9 at the beginning of the item you're interested in talking about. When you do call in, mute your TV, because if you listen to the TV, it is time delayed from the phone and you will miss your opportunity to speak. So it's important to turn your video feed volume off. When your number is called to speak, you press *6 to unmute yourself. Generally, you'll have 3 minutes, although that can vary depending on the item. And I'm consistent with the time limit, so don't take it personally if when you are told thank you, it's the end. But before all that happens, you are going to hear this sound, which basically tells you you have 30 seconds to wrap up. And then you will be thanked and we will move on to the next speaker. So, thank you very much for trying to help us with that process. So I'd like to ask our CAO, Acting CAO Hayes, are there any modifications to the agenda?
Thank you, Chair Bass. There are a few modifications. Item number D9 regarding professional services agreement with Cooperation Humboldt will be pulled for discussion. Item D17 regarding library contract with AT&T will be returned and return at a later date. And item I1 will be pulled and the meeting of August 31st will take place.
All right. So with those modifications and adjustments, is there a motion to approve the consent calendar with item D9 pulled off of consent and D17 removed from the agenda?
So moved.
A second?
Second.
All right. So we will go to public comment on the consent calendar. And if you are planning to talk on this on the consent calendar, press *9. You have one speaker. Anyone else who is listening, please press *9 if you want to speak on the consent calendar. All right, so we do have 0151, and I believe that's Dottie. Welcome.
Good morning, Dottie Russell here, and Southern Humboldt. There's so many things on the consent calendar. It's hard to even know which one to talk about. But you do have some contracts going on, it looks like, on the consent decree or calendar to work with some agencies to help with health and human services, multiple different ways, with the Sheriff's Department, I think, with an incentive. So it's occurred to me that if you have people leaving in droves that work for the Sheriff's Department, it would be a good idea to screen these guys, if they would take the time to do that, and say what things they find it difficult about working for Humboldt County. So I was talking to a sheriff yesterday about how many people are leaving and going to Reading and I guess other places too. So the idea of an incentive is great, but let's find out why they're leaving so that the incentive is really going to work, and how long is the incentive going to be for? Are they going to make a contract for 2 years, 5 years? How's that going to work? So that's one thing. And along with that, by not having enough staff and by having it take 3 hours apparently to fill out a police report that somebody is trespassing on somebody's piece of property, really is a deterrent for a sheriff or a deputy to want to write a report every single day. So they think that the tickets are just going to be thrown away if this guy's going to, have just a trespassing ticket and whatever. But there are multiple people that are very upset about somebody that mental health is compromised, dangerous. This morning, I got a text from somebody that lives in this town that said he was getting a gun and was going to shoot this person. Do I call Adult Protective Services? I called sheriff. I talked to the again yesterday. So I think I just got a beep, but I'm telling you, we have an emergency here and somebody's going to get hurt and I don't know where to go and I don't know where to get help. This person needs help, but so does the community, and nobody should get hurt. So good for the incentives, keep it going. I think my time's up. So if anybody can call me and offer any suggestion, I'll call Hansel's office today and see if we can get help there. I don't know what to do. Thank you.
Thank you, Dottie. All right, our next speaker is 3816. That's you. Press *6 on mute. Welcome.
Hello, this is Jeff Hedin. Wanted to ask about the demolition of the Vets Hall and the issue of things to be donated versus stored. I didn't see anything about how we would meet to decide which of the items that belong to the Veterans Associations would be stored and where, and how will the donations be distributed?
All right, well, we can't answer those lifetime here, but after we're done with public comment, we will go back and find out what some of the answers are to your questions. You still have time remaining, though. I stopped your timer, so if you want to continue speaking, you certainly can.
No, that was all that I had without hearing you first when we come to that point in the consent calendar. Will you guys discuss the agenda items of estimated cost and will there be a discussion of timing? Should I stay on to listen, or will the subject just come up for a yay or nay decision?
There'll be discussion. I would stay on watching I would stay on watching us. I know Supervisor Bushnell, who I'll go to after we get through the commenters, I think has a plan for how to get the information to the correct sources, but we'll go directly to her right after we're done with public comment, okay?
Okay, thank you.
All right.
That's all I have.
All right, thank you, Jesse. Next number is 2902. Press *6 and mute. All right, you're tuned. There you go. Welcome.
Thank you. This is Doug Battles from Southern Humboldt Veterans Association also. And I'm kind of reflecting on what Jeff had to say. The veterans have been talking at their last 2 meetings about moving their equipment from the kitchen, billiard table, cabinets, other things that we've put into the hall. And our big sticking point is that we haven't been given any type of direction as to where these items would be stored. We've been looking around and, the Grange Hall now is a private residence, and there really are no facilities that could help the veterans themselves get that going. I'd like to see the demolition go as quickly as possible. That way we could get our hall back as quickly as possible. And also, we're not being involved in the planning of the new building as of yet. We would really like to have a lot of input into what is being stored, or not stored, but built, and even a footprint so that we know what we'd be working with. We do have a local architect that has volunteered his time and effort to help us out with the structure. And many of the veterans down here are also contractors or builders. So we need to be involved more with public works so that we know what's going on and we can help out with, like, taking out our really nice hardwood floor. We'd like to save that, you know, and I noticed that was in the agenda notes that that was one of the things that you guys are actually pondering. So if we can help with salvage or anything else that we could do, design particularly, we'd, like I said, like to be really involved in that process. And we're eager to get this whole thing going and have the hall open again. That's about it for the hall. The first caller talked about the sheriffs leaving and stuff like that. It might be because they're feeling like we are, kind of ignored by the county. Do you guys know that the sheriff's office in Garberville hasn't had air conditioning for 2 years? And when it's 103 in Garberville, you know it's going to be 105 or whatever in that little cave that they're in. So you want to give them some incentive, listen to them.
Okay.
They'll tell you what they need.
All right.
Goodbye.
Thank you, Doug. We have one more hand up. If you're still wishing to talk and you haven't, press *9, but at this moment we will go to 7108. Press *6 to unmute.
Hi, this is Bonnie Blackberry calling it in from Southern Humboldt. And I wanted to support the vets in their effort to get our vets all back. And I saw the demolition plan was for 6 to 9 months, was going to take them to do that. I would hope that during that time, the county meets with the vets and starts working on the plan for the new building, not waiting until it's demolished and then wait and go to the board again and get permission for this and just pass it along, taking up a bunch of time. And I really hope that the vets are more involved than they have been in the past with this process. And I also want to say that being able to participate in these meetings live remote is very important. And I know the board had talked about going back into regular meetings, and I'm not sure when that's going to happen now with what's going on with this pandemic. But I hope that you're working on now making it possible when that happens to continue with this option for the general public to be able to call in and listen and participate. So work with the vets and let's keep this live remote going. Thank you.
Great. Thank you, Bonnie. That are all the public speakers, so I will return to the board and I'll go to Supervisor Bushnell.
Thank you. I just want to make a brief statement. I have talked with Public Works and through our CAO and to engage the vets in Southern Humboldt more and to let them know what's going on. Additionally, I had asked if they wanted this agenda item pulled for discussion, and they had told me they didn't want it pulled, and we're happy that they were that we were getting something going. All of the questions they have can be addressed through Sean from Public Works. He's on vacation, but I will reach out to him and get your answers. And then also for the question of no air conditioning at the substation in Garberville, we have a new sheriff's building there that does have air conditioning and will be occupied, I'm hoping, within a month. So thank you to everybody for their questions about the Garberville Vets item.
All right, thank you. Any other supervisors have a comment on the consent calendar? Supervisor Bohn?
I do. Oh, never mind. The Supervisor Bohn first. Sorry.
And nobody's using the push your yellow hand, so I know who's going to be first.
Yeah, we have Robert Nickel retiring out of Weights and Measures, out of the Ag office, and I've known Robert for, well, his whole 34 years here because he did Weights and Measures, so which is gas pumps, everything else. So, but he's basically done Weights and Measures in the program. He has provided training, all the people coming in, a certain amount of leadership when Jeff was out of the office. He's just one of those good guys. His kid played in my little league. He helped. So he's just one of those good guys, but 34 years, most people bail at 25, 30. He's been here 34 years. And I want to thank him for everything he's done. And I think he's going to hang around, train the new guy when we find him. So I just think somebody that's done 34 years in the county deserves it. One department doing the same thing and did it very admirably. So thank you, Mr. Nickel. And I don't know if Jeff Dolph is on here or not, but.
Do not see him at this point.
All right.
All right, Supervisor Wilson.
Thank you. I just wanted to acknowledge 30 years of service to our community from Arcata House. And so it's just that we have a resolution on here, and I'll just read it because it's pretty short. Whereas Arcata House began in 1991 when a group of concerned citizens wanted to address the growing homeless population, and whereas with funding from the city of Arcata, the first shelter was opened and staffed solely by volunteers. And whereas in 2012, Arcata House Incorporated merged with Humboldt All Faith Partnership to become Arcata House Partnership. And whereas a leading service provider in Humboldt County, Arcata House Partnership offers services to people living on the streets, people living in substandard housing, people who are economically disadvantaged, and people who are hungry. And whereas Arcata House Partnership services provide outreach, street service, access to food and clothing, access to bathrooms and hygiene stations, emergency shelters, rapid rehousing, permanent supportive housing, community education and membership, advocacy, emergency response teams, and so much more. Therefore, be it resolved that the Humboldt County Board of Supervisors hereby congratulates Arcata House on 30 years anniversary and wishes them the best as they move forward. I just want to say to everyone who has volunteered over the years and worked with Arcata House and all the supports services from all of the agencies that have supported, and as a citizen of Arcata, but also understanding that Arcata House serves so many more communities outside, I just want a big heartfelt thank you, and especially to Darlene, who's kind of the leader at this time of Arcata House and just doing so much. And I can't tell you, there is a lot there involved in integrally with the county and other agencies. So thank you, Arcata House. Really appreciate it.
I want to echo everything you said. They're pretty awesome. And I had no idea until I became part of the county family just how deeply ingrained they are in what they do. So congratulations to them. Any other comments? Supervisor Madrone?
Yes, I would just like to closely associate myself with Supervisor Wilson's comments as well.
Okay. I don't see any other hands up. So Tracy, can we have a roll call vote?
Yes. Chair Bass.
Yes.
Supervisor Bohn.
Yes.
Supervisor Madrone.
Yes.
Supervisor Wilson.
Yes.
Supervisor Bushnell.
Yes.
Passes 5-0.
All right, so we will do one more thing before our special presentation. We're going to move on to public comment on items not on the agenda. So if you are wanting to comment on an item that is not covered in today's agenda at the time, I press *9 to raise your hand and do so quickly. I see 2. If you're interested, be sure to raise your hand so we know you're there. So our first speaker on non-agenda items is Dottie. So welcome.
Thank you. So right now we have this crisis on housing. We're getting funding from Sacramento, possibly the federal government as well. We have a crisis about what's happening with the COVID, which I don't know if we're going to have a report on that, but I didn't see one on the agenda. And so we have this housing crisis, we have a pandemic, and we have some people that are staying on the Yeehaw Ranch. So I understand you might be getting a little tired of hearing about it, but the bottom line is those are human beings that have someplace inside to be. Now, watching the situation in Southern Humboldt of people, not having someplace to be, a homeless guy that I helped for a while get off drugs came to me yesterday and said, "Oh, I'm off drugs and it's so great and I'm so happy and thank God and thanks for praying with me." All of that is really terrific and I appreciate it. But when he reached over and gave me a big hug without wearing a mask and knowing that he doesn't have housing, it did freak me out a little bit. So if we could get some more people into some kind of shelter, whatever it is, and make sure that they're vaccinated if they want to be vaccinated. Obviously, you can't make them, but let's get them aware and and know that just going up to somebody, it's nice that he said thank you, and I appreciate that, but a hug at this point without a mask, not knowing if he's been vaccinated or what's going on with the surge thing, it was a little bit upsetting. So what can we do to keep all the people at Yeehaw calm and collected for right now? This is not the time to be bulldozing a building. I have comments about the Vets Hall. Good for you for going. Yes, but that was on the consent decree, so I can't talk about that right now. So please help us with people that are homeless, people that have mental health issues, people that need to be housed right now. Don't eliminate any possibility, not through code enforcement. Let's see what happens. Give it 3 months. See what's happening with what's going on with the surge and people and making sure that they have access to whatever they need and being safe and training them to be wearing masks and doing elbow hugs at the best. So please help keep the surge from getting worse. Help these people from being out there. Who knows what'll happen to them. So it's not safe out there. I wouldn't want to be out there. I don't think you'd want to be out there. So let's make sure they're not out there in the streets and having to do drugs so that they're accepted by somebody that's living in the woods with them. I don't know, but we need help. And please don't eliminate anything right now that somebody could be in. Thank you.
Great, thank you, Dottie. And the last speaker has the last 4 digits of 0326. And if that's you, press *6 to unmute. All right. Here's 0326. Press *6 to unmute. Welcome.
Hi, this is Charles Wilson. It's taken me 20 minutes to get into find the phone number and everything of your Zoom thing here. Your system is terrible. Anyway, 2 weeks ago, that's August 10th, at your board meeting, I told you about my attempt to get an answer to a simple question at the public health vaccine tent on the C Street concert. I was ignored. Then I got a sarcastic comment. Then I almost got pepper sprayed. Both Stevens and Hoffman heard what happened. Now, neither answered my simple question, and both used the standard weasel words to avoid answering. Stevens described how vaccines in the past were not experimental. That's what I had asked about, and said that the vaccine had been studied for 2 decades. Hoffman repeated that the vaccine was not experimental, but life expectancy did not explain.
Hold on, Charles. I'm stopping your time at the moment. I'm just letting you know, you are kind of going in. We have a COVID update, and while I know you want to talk about another instance, you're now going into what I think would probably be more appropriate in the COVID update. So I would just if that's, and if you're just touching on that now, I'm going to add something else here on public comment. But if you're going to remain on COVID, I suggest we just let you comment under the COVID update where you can actually get answers.
Well, I would like to get my comment in. The thing is, this is not in response to anything that you're talking about on the agenda there. I thought this was something that had happened before, in which I've been had very difficult time of getting you to respond to, and it's an entirely different question of whether you're capable of having the health department respond to an answer to a question that simply provided there, and not be pepper sprayed.
Stop a second, Charles. Let me start your time, okay? Now you can go if you really want to do that. I believe you actually be appropriate in the next one, but go ahead on this one and just make sure you make it very different than our update.
Okay. Anyway, yeah, I mean, I'm not talking about what's on the agenda, because usually you have to wait on the last time I waited on the agenda for 3.5 hours before I could talk. But, like I say, it's your Zoom thing is terrible. You can't find out anything. Anyway, Hoffman repeated the standard patronizing political solution that the unvaccinated 45% of Humboldt County only needed to be educated. Now, I'm one of those ignorant second-class people who need to be educated. I've listened for everybody for almost 2 years. I'm still ignorant. I didn't get an organizational chart from the job descriptions from county personnel, but I assume that the EMTs are supervised by somebody under Stevens and Hoffman. Neither one offered to do anything. If the EMT had pepper sprayed me, the county would have been facing a big lawsuit. Apparently, the two highly paid supervisors do not know how to control and train their own employees. Apparently, they both want to feed the conspiracy people, I'm not one of them, with further proof that the Gestapo force will be coming with some form of education. I appreciate Supervisor Madrone's suggestion that there might be other ways to approach the COVID problem. I demand an apology from Hoffman and Stevens for the action of their employees. I demand that the two EMTs be counseled. You can't get rid of these guys. You're in the county and you have all kinds of procedures and everything, but at least talk to them. Don't tell them not to spray somebody that asks a question. Well, I'm one of those ignorant people that are asking a simple question, and I shouldn't be pepper sprayed just because I ask a simple question. I did not, if they don't want to apologize or counsel, then they're not performing their duties that they're being paid for. And I suggest that they both be fired. Anyway, that's all I have to say. Thank you. Bye.
All right, so we have one more hand up at 7108. Press *6 and mute.
Hi, this is Bonnie Blackberry again. I just wanted to voice my concerns about the code enforcement actions at Yeehaw. This is a place where people are living, have been living, and people haven't been getting sick because of the conditions there or whatever. And taking people and removing their homes when we don't have enough housing already. It's just, and doing this during a pandemic, it's just, I just can't understand how the county can be doing something like that. Thank you.
All right, thank you, Bonnie. So that is the last person under the comment on non-agenda items. So now we will go to the COVID update. And I do believe we have Dr. Hoffman and the rest of the team here. So I'll turn it over to you. Michelle.
Good morning. Thanks, Chair Bass. Thank you, supervisors. Thanks everyone for being here today. So Humboldt County continues to see a COVID-19 surge fueled by more contagious and faster spreading Delta variant that is yet to show signs of decreasing. There are early signs of a plateau, which is encouraging. For the first time in over a month, the case count per 100,000 is not continuing to rise at dramatic rates week by week. And there's a graph. I'm not sure if I can share screen here. I'll do it when I'm done. see if we can put this graph up and share it with everyone. But the most recent graph, which has been out in the media since last week and published on Friday, shows that the week's case count for unvaccinated topped out just over 70 per 100,000. And that for the fully vaccinated, that was for the unvaccinated group. And for the fully vaccinated group, there was a slight decline in the case count for the first time since this latest Delta surge began. For now, we should all remain vigilant until real decrease is seen in both cases and hospitalizations. On hospitalizations, we know that there's a lag in those by several weeks compared to the case counts, and the hospitalizations have not yet plateaued. The hospital is feeling severe impact, and our local healthcare workers are just under severe distress and duress right now. Many critically ill residents have been transferred out of the county due to lack of bed space in our local ICUs, and that bed space is really lacking for staffing issues. We have beds, but they're not able to staff them. Plans have been in place for weeks to try to increase the staffing in the hospitals, but due to significant staffing shortages across the state and the US, we were really meeting a lot of difficulty getting those staff secured. When I submitted the report last week, we hadn't had staffing. We actually just heard last night of our ability to secure some staff to increase the number of ICU beds. So that should really help, and we'll see how that goes over the next few weeks. The ICU capacity has been at or near 100% for the past 2 weeks. And this continues to be half or more COVID patients in the ICU. That's resulted in cancellation of needed medical procedures, surgical procedures that were deemed not to be absolute emergencies, but still very needed by members of our community. The types of care that become deferred by the hospital during a surge of this type include things like heart surgeries, cancer surgeries, joint and back surgeries. Sometimes these are surgeries that were already put off by weeks or months due to previous COVID impacts on the healthcare system throughout the pandemic. We've also seen an increased trend toward younger and younger hospitalizations over the course of this Delta surge, likely since this group has the lowest vaccination rate in our county. Public health continues to message on prevention of COVID-19 by wearing masks, avoiding crowds and gatherings, and getting vaccinated. With school starting again across Humboldt in the last week or two and continuing over the coming weeks, vaccination against COVID-19 for anyone 12 and older is the best tool that we have to keep schools and businesses open and reduce COVID-19 impacts on the hospital locally. Vaccination efforts have increased over the past few weeks for the first time since June 15th reopening, with most vaccines given in the past week being first doses. And the increases have been small, and potentially the new requirements for vaccination in healthcare workers and education might start to increase the vaccination rates even more in the coming weeks. Our mobile SNAP nurse team continues to work throughout the county at events, organizations, places of business, schools, all who are willing to host vaccination events. Additionally, vaccination continues to be available at many pharmacies, hospitals, some primary care providers. And with the announcement of a third dose of the vaccine in the series of Madrone and Pfizer for a small portion of the population, we should see some increasing numbers again in the coming weeks with vaccines being given. We do want to note that there is sufficient supply currently for this. And so anyone who is in that group of folks who are defined by the CDC as severely immunocompromised or recommended by your doctor to get a third dose should go seek one out at one of the vaccination sites around the county. It's estimated about 3% of the population fits into that group. So we are very confident that there's enough vaccine right now for that group. The FDA is looking to potentially approve a third dose for many more people in the coming weeks. And Humboldt County Public Health is watching closely so we can plan for larger increases in demand by coordinating resources for delivery and supply of any newly approved third doses. Full FDA approval just happened this week, and that could also increase demand for the vaccine, which again, we're very prepared for. Approval for those under the age of 12 is not expected until later this year, potentially early 2020, unless a significant change is made at the federal level for the current timeline of FDA approval in this age group. Testing capacity in the county is very strained in the past month with the swift rise in cases due to the Delta surge. There is evidence that testing capacity is improving with increased capacity at Optum fixed site here in Eureka at the Wharfinger, and the return of the mobile Optum sites in Garberville, Arcata, McKinleyville, Fortuna, and Hoopa. We have also had a SNAP Nurse Rapid Response team here for the past few weeks who's been going to businesses and geographic areas of significant outbreak of COVID-19 in Humboldt County. That team has since left, and should we need another team, we will request one from the state for rapid response and outbreaks. The testing has also increased in many businesses and organizations through a state-based testing partnership, which can be accessed on the CDPH Testing Task Force website. And many schools have signed up for testing, some looking to help test the community as well. It's expected that testing with rapid tests will continue to expand in the coming weeks, both in businesses, schools, and in healthcare through these types of programs. Testing done through the state-based program through a healthcare facility or through Optum state testing is reported to the state disease monitoring system known as CalReady, which then gets reported here to us locally in the health department. I wanted to note that home tests do not report to public health, and there is no current way to report or record a positive home test unless they're done through an online proctored exam that some companies do offer with their tests. Otherwise, if documentation is needed for a home test, the current recommendation would be to seek out a new test that will report to the state reporting system through one of the above mentioned sites. So COVID-19 has proven to be a formidable opponent, and it's safe to say that we're all exhausted at this point. We've all suffered losses, whether directly or indirectly, over the past 18 months. What has been evident, however, is the community's ability to pull together and quickly make new plans when COVID-19 throws something new our way. We at Public Health greatly appreciate the community's ability to react quickly as things change quickly and to offer to protect yourself and your community by doing things needed to end this pandemic sooner. For now, until the end of the current surge, please continue to mask, avoid large gatherings, get tested, get vaccinated. And I want to see if I can share my screen here and show. All right, can everyone see this graph here? So I just wanted to point out so we've been updating this every week for the last 3 weeks. And you can see here, this was our first surge back in December, January with the Epsilon variant, the West Coast variant, case rates topping out in the high 20s. This was before the vaccine. So these were all unvaccinated. The blue line continues unvaccinated, and we pick up the orange line here as we get some fully vaccinated folks in the early part of February with a couple of breakthrough cases throughout, but very small number of breakthrough cases. With the Alpha variant that we saw here in April and May, again, we saw unvaccinated case rates topping out in the 20s with very few fully vaccinated folks becoming infected. And then this is our current surge with Delta, with tremendously high case counts in the unvaccinated group and significant numbers in the fully vaccinated. And I would add that we're seeing a decrease here. We see that pretty much right in line when our mask mandate went back into effect. So very likely that folks who are following the mask mandate are seeing lower case counts in the last few weeks and lower spread in that section of the community that's following public health advice. So we will continue to monitor this and update this as the pandemic and this surge unfolds in the coming weeks. Thank you for your time. And if anyone else on the public health team has anything to add, Director Pereira, Director Stevens. Thank you.
Dr. Stevens, did you? Nope, no one yes yet, maybe later. Okay, supervisors that have questions, comments, solutions. Supervisor Bushnell.
Thank you. I wanted to thank Dr. Hoffman and Director Stevens. I made a phone call to them a couple weeks ago about my district and some testing that I wanted to get down that way, and they were very responsive, and we were able to get testing units down in the southern South County, and I really appreciate that, and just want to say thank you for being so responsive. Additionally, I wanted to ask a question about the Delta variant. When we're testing for positives, is that part of the test? Do we know the difference? I've gotten questions where they've gotten their results back and they were positive, but they didn't know whether it was the Delta variant or just regular. I don't know which one to call it at this point.
So we don't report out the variants to individual patients. There's no real clinical usefulness for that because from a patient-to-patient level, it doesn't really matter which version of the coronavirus it is. We use that as a public health tool to monitor the situation and know kind of which way things are headed. And we know based on nationwide, statewide, and local data that at this point, Delta variant is pretty much the only thing we're seeing. And it happened, if you go back to that graph with that very steep rise, that was the shift where we saw, in the beginning of that, maybe 10% were Delta. At this point, over 90% are Delta variant. And there's absolutely no indication right now that something is coming on its heels. Globally, the picture is that Delta will very likely dominate and become the dominant strain. For now, there's nothing else that's looking like it's going to overtake it.
Okay, thank you for that. And then I also am getting several questions about masking outside in uncrowded playgrounds where the students can be more than 6 feet apart. The statement that I'm hearing is they're having to wear the mask obviously for 8 hours a day. And if they're able to go outside and be away from people or, separate so that they can get some fresh air, some of the schools said they reached out to you and you told them they have to mask all the time. And, I read in general, people do not need to wear masks when outdoor in uncrowded areas where it is easy to maintain distance of 6 feet or more from those who are not in your household. So that's the CDC. I'm reading from the CDC. So could you just address that a little bit, please?
Yeah, and that language is on FAQ that we sent out this week or last week to all the schools. So we took that directly from the CDC. We're following those CDC guidelines, and I can share that with you guys as well. And yeah, so we recommend in crowded outdoor situations where it's not possible to distance that everyone wear a mask, including kids on a playground. If it is possible for them to distance, then of course they don't have to mask. And we would encourage people to take mask breaks if they're distance and, allow kids that time for sure. So hopefully that was cleared up in that letter that we sent out this week to all the schools with that very specific language that you just read, Supervisor Bushnell, that when distancing is possible, a mask is not necessary. I think we all can safely say, though, that in most playground situations during recess, during the majority of that time, that's not likely to be the case. Kids are going to want to be close by and near each other, but certainly giving them time that is unmasked and distance is a good part of any school program.
Okay, I don't think that it's been cleared up because I got these questions last night and this morning, and so and I think in why I'm getting the questions is in the South County, we have a school that has 30 students total in that school, and they have 8 in their classroom. So when they do go on the playground, it is very easy for them to distance on the playground. And I think when we're saying, it's not easy to distance on a playground setting, I think we need to take into account, the population of the school. That not every school in our county is heavily populated. And I think that's why I was receiving the questions. But I do really appreciate your update and what you had to say. Thank you, Dr. Hoffman.
Yeah, and let me share with everyone this. So this was what we sent out to all the schools through HCOE. Does everyone need to continue to wear a mask indoors, outdoor, regardless of vaccination? In general, people do not need to wear a mask outdoors in uncrowded areas where it's easy to maintain distance of 6 feet or more from people who are not in your household. So it's very, we support that. Again, I think it depends on the situation, very, very much scenario dependent.
Yeah, well, thank you for that. I really appreciate all your guys' work.
Thank you.
Any other supervisors at the moment? Supervisor Madrone. I have some, but I'll go with Madrone first.
Thanks, Madam Chair. Well, first of all, I just want to say a big heartfelt thanks to all of our healthcare workers all over the community. I know, as Dr. Hoffman said, we're all pretty burned out. We're all, at our rope's end, so to speak. And this has been a long haul. So I just want to thank everybody that's out there on the front lines trying to help our community through all of this. With ICU beds at capacity, just all this stuff, it just really does amaze me that so many folks still don't want to get the vaccines. But, if we just continue that approach of just being like, why aren't you doing it? That's not necessarily going to change that scenario, right? Because people have kind of dug in pretty heavily on one side or another of the issue, and they continuously seek out information that reinforces their opinions or positions. And that includes me. We all do that, right? And so what I said a week or two ago, and I'm going to say it again, is I think that we need to try to broaden our approaches to help everybody be more on board with helping out at whatever level they can. Obviously, from my perspective, vaccinations is the way to go. There is no doubt in my mind about that. But there are many people that don't agree with that. And so, I get a lot of information. I'm sure all the other board members do as well, of information people find on the net, here, there, whatever. A lot of it's pretty wild and wacky, but there is some stuff that seems to rise to the top. And one of those is there are other treatments with monoclonal antibodies, not treatments, I'm sorry, other drugs out there that have been used successfully to prevent getting sick with COVID, including monoclonal antibodies, Regeneron, and I believe the other one is Indivimab. Sorry if I'm mispronouncing that. And so if those drugs are more acceptable to folks that don't want to get the vaccinations, and they have been proven to be effective at prevention, not at treatment. If you get COVID, they're not going to change your situation, as I understand it, but they can be effective in treatment. And in the discussion we had, Dr. Hoffman, you had mentioned that you found that to be true in general, but you're not able to get the providers locally to really engage in utilizing these drugs. So I'd just like for you to talk a little bit more about that and what you think about that as an option, in particular for those folks that don't want to get the vaccination for whatever reason that is. Maybe many of them would be willing to do some of these other kinds of prevention measures, right? Clearly still masking, distancing, and if you want to be unvaccinated, stay home if you can. or at least wear the mask and do things. I mean, there's so many things we could all do. We're all in this together, and we all need to do whatever we can, whether we agree with vaccinations or not. There are other measures we can take to try and protect our families and our communities. So I just wanted to speak to that a little bit. And the last thing I wanted to say is I'm glad we're starting to ramp testing back up. I get a lot of comments from people saying that, convenient testing is a really great tool to help people understand what's going on, what infections may or may not be happening in their families, et cetera. So I'm glad to see that's ramping back up. I think we need to have significant testing options for people throughout the community. So anyway, I just wanted to share those thoughts, ways to try and help our whole community be on board at whatever level they're comfortable with to try and get this thing under control. So thanks.
Thank you, Supervisor Madrone. If I may address the monoclonal antibody comments. So this, I will say, is not an easy treatment to pull off. We're talking about an infusion that takes several hours of the infusion time, monitoring, space, staff. So we have been looking at this since these first came out, last year, and there was never a time or a place that they really the ability to pull it off was there. There was definitely interest, and I think a lot of the folks across the across the spectrum of the medical community here have been working on this for a while. I do know that as of this week, St. Joe's has a plan in place to begin doing monoclonal antibody infusions. So I don't know if it's absolutely finalized yet, but that plan is very close to being actualized. So we should start to see some of that going into effect. And as well as some other providers who are consulting with us to try to see what they can do to do these very labor-intensive treatments, but they absolutely help, and they help keep people, especially out of the hospital. So these are really designed for folks who are pre-hospital, not that sick yet, know that they were either exposed or know that they're positive and are either asymptomatic or starting to get mild symptoms, and they have a risk factor for developing severe COVID and being hospitalized. So there's definitely, now, given the situation, the medical community is jumping into action and taking the hard steps that it will take to put this into play. So I think you will start to see that in the coming weeks, that the treatments will become available here locally.
Did that answer all of your questions, Supervisor Madrone? I just wanted to kind of talk a bit about businesses. We're glad businesses are open. Unfortunately, with people not always being responsible with their actions, I think they're unwittingly actually really harming a lot of our local small businesses. If you're a small business with very few employees, one exposure, and you have to shut down for a week or whatever, it's becoming incredibly, it's impacting a lot of businesses very negatively right now. And part of it is what we do. I would like people to be responsible. If you don't have your vaccination or, wear your masks. Personally, I was not going to go anywhere near the fair. I think that was the worst idea. I would, it's just my personal opinion. I love the fair, but it's not a place that I wanted to be. So, I purposely try to stay out. But I'm also hearing that some of us are, we'll be wearing masks one where, but we're being seen in bigger groups of people and in locations, and it's getting out there, right? So I had like an hour-long conversation last night with some people, a person who was feeling pretty hot about it. And I completely hear what they're saying. And I guess I would ask you, Dr. Hoffman, I know it's when you talk mandates or we talk about proof of vaccination, it gets really touchy. But I think, local businesses do have the ability to require proof of vaccination to enter, correct? And I mean, and if they do that, I would just ask people to please don't give them a hard time. They're doing what they can do to survive. And right now, a small business, our office was closed for a week because there is a bit of an exposure. I can't imagine if I had a business these days wondering which employee might be exposed. And so I just think I'm asking people to try to be more responsible. And I know you may not like to wear the mask, but it's important right now. All I can say is I'm a grandma whose grandchild is now is not allowed to see anyone for his second birthday because of the fear that this 2-year-old has no protection. And I completely get that. So I think sometimes people are just in such a hurry to resume life that they're kind of forgetting that there's a bigger picture of how to approach it. Anyway, it's just I've been hearing from folks, and I think they feel that we have not been strong enough on how do we get people, how do we enforce it, and we already know there's not a lot of mechanism for that. And so I guess I'm just asking Dr. Hoffman, like, when these small businesses, have one person, how long do they have to close down if there's been an exposure?
So, yeah, thank you, Chair Bass. Lots of great questions in there. I think the first point I'll start with is just that the masks absolutely work. And I think if we look at that graph that we had up, we see exactly how they work. The unvaccinated group continuing with very high case rates, and the fully vaccinated group who, we know based on data, those are the folks who are following the mask mandate the most. Are now the case counts are dropping, and we're seeing lower hospitalization rates among them too. We had seen hospitalization rates upwards of 25% fully vaccinated, and now they're down to around 10%. So, and we've had days with no fully vaccinated people in the hospital. It's really changed. I think the mask really works. To touch on the other points you mentioned, businesses being able to do their own, plans for COVID mitigation. Absolutely. Any business can require vaccination status or proof of a negative test in the last 72 hours, or any of the other, mitigation measures that were used last year, like spacing out tables, obviously requiring people to mask. So those things can protect their business, can protect their employees, and we hear every day lots of stories of businesses not able to maintain being open because of staffing issues. It's not that public health is shutting them down. They don't have enough staff to remain open. They have to close because of staffing. This happens in restaurants, other small businesses. We've seen daycares shut down, over staffing issues, and I worry for some of the schools that have lower vaccination rates and higher numbers in their communities that they might be facing the same thing very soon with high rates of COVID and many people out on isolation and quarantine. They won't be able to keep the schools open potentially. So these are very real concerns. I think the testing that we have available to us will absolutely help keep those businesses open. Any business can apply through the CDPH Testing Task Force website, which we've been promoting for months as an opportunity for businesses, organizations, community faith-based organizations. Anyone can really apply for that program to do testing in their location, and so that would also be really helpful for them to keep and maintain staying open. And so did I get on all of your points?
I think some of it was just not necessarily a question. It's just that recently more of what I've been hearing of just frustration with I think most people are fine and they try to be responsible. There's just always going to be some that aren't necessarily interested. And I think I just would like people to look when if a business asks you to please do X and Y, it's not because they're trying to be difficult, it's because they want to stay open and they want to keep their staff healthy, I think. And I'm just not sure if people are keeping that in mind. I think people are there's flashpoints now. People are getting mad quickly over things that are not meant to cause that reaction. But that is, we all have our own personal opinions. That's mine. And now we'll go to Supervisor Bushnell.
I thank you through the chair. So I have I just want to clarify something. So if I have a small business that has 2 employees, and one employee tests positive, then the employee, of course, quarantines, and the other employee has to be out for 5 days. Is that what 5 days and then test? Is that?
So the person, anyone who tests positive for COVID-19, whether they're vaccinated or unvaccinated, must isolate for 10 days. So that's the isolation period of the person who is positive. For any of those close contacts with that person who's positive, which has to meet that definition of less than 6 feet or less for 15 minutes or more. So if those people were distancing in the workplace, then they wouldn't be a close contact. If they were not distancing based on the nature of their job or potentially outside of work, they were exposed to that person in a more social situation, then they would quarantine for 10 days. So the quarantine period is 10 days. We have allowed for modified quarantine for students. Students can take a modified quarantine where they, so this is not for the positive student. A positive student must stay home and isolate, but an exposed student who's exposed in school under supervised, masked, supervised exposure, less than 6 feet for 15 minutes, can stay in school during their quarantine period, but only for in-classroom instruction. They can't do any other extracurricular activities. They can't go to the grocery store after school. They're supposed to be at home quarantine throughout that whole time. They can also shorten the quarantine period to a 7-day quarantine, regardless if they take the modified quarantine or not. And that's what you're talking about there with that negative test on day 6 or 7. They could shorten it to a 7-day quarantine. That's only available to students in a K through 12 setting. CDC and CDPH have allowed jurisdictions to implement a 7-day quarantine for everyone. I would hope that everyone would understand that currently, given our situation, that is not a prudent thing for us to be doing. So we have not adopted that locally into our quarantine. We will be looking at adopting a 7-day quarantine at some point when it makes sense. But currently, the current quarantine period is 10 days for anyone who's not a K through 12 student, and there is no way to test out of that early.
Thank you. My next question would be, I heard you say that after 10 days and a negative test, they could go back to work, but I've heard conflicting statements, people saying that they've tested positive without symptoms well past the 10 days. So could you clear that up for me? Like 20 days of positive test when they were COVID positive, 20 days prior to, and are not symptomatic.
Yep. So you do not have to have a negative test to finish quarantine, although a test is recommended for people in quarantine around day 5 to 7 after the exposure. But it is not a requirement as part of quarantine. The reason we would recommend it is because if you were in that situation where you were asymptomatic positive and then you didn't test and you only stayed in the quarantine and then you tested again 2 weeks later, you would now have to isolate for 10 days. So anyone who tests positive though, so any positive test that's a verified, I should say, not a home test because we don't have any way to verify those. But if you've had another verified test, COVID test, you do not need to retest for 90 days. And so if you are in a work situation or a school situation, or you were exposed again, you wouldn't necessarily need to retest because you might remain positive on that test for 90 days. The only reason would be if you were having symptoms of COVID that were concerning and you would need to retest, or if a medical professional recommended that you retest for some other reason. But otherwise, yeah, the 90-day period after the original positive, you are not to retest.
Okay, so quarantine after a positive for 10 days or until asymptomatic, and then no test for 90 days after your quarantine and your symptoms go away.
After a positive.
That's what I said.
Well, quarantine isn't the same as a positive. And maybe you meant isolation. Isolation is for the positive. Quarantine is for an exposed person. Sorry,
Okay.
I know it's very technical language, but it's important because we have to recognize that people who are in quarantine are not positive. They were just exposed and they may turn positive. So those people who are isolated had a positive test, and those are the people who should not retest for 90 days.
Okay.
But people who are in quarantine, they might test negative in their quarantine if they decide to test. If they test negative, they might need to test again in 2 weeks because they have another exposure.
I understand that. Yes. Thank you very much.
Supervisor Bohn.
Hey. Thanks, you guys. You're doing a good job. I want to reiterate what one of the supervisors said about the testing. A lot of testing going out there. I've been pretty vocal since day one. I don't think anybody doubt where I stand on this stuff. But I think what you have to realize and listen to yourself, when you're talking about any outside treatments and labor intensive, talking with Roberta this weekend, today and yesterday, they canceled elective surgeries because they didn't have staffing. So I don't know. I mean, this is the issue that we're facing. This is what we're facing as a county as a whole. And the numbers are appalling. And these weren't all people that were going to die anyway. They were sick, they were old, because I qualify for all of those, so I hate hearing those. But these were people that were alive and now they weren't. And contributing factor was COVID. Vaccines will cure that up. Masking will cure that up. If we can get through this, maybe that's all we have to do. But I mean, there's going to be events. I'm not going to pick one event. I probably was at 6 different things that had over 100 people at it or around it. And the one thing that wasn't prevalent was masks. And there's still a fear. I mean, even though we got FDA approval on Pfizer, Madrone is going to be, they're going to be bouncing right behind it. And I think somebody sent out a number that 30% of the people that are unvaccinated will get vaccinated now because it's got FDA approval. So they're going to trust the same government that they didn't trust before. But I don't know how we get, and it goes back to education on the vaccine. I mean, I think that's what we should focus on, because if we're all going to sit here and say it works, it's somehow we're going to have to educate people and not off the internet. I mean, I printed 63 things that I got the other day that were, and I am vaccinated. I haven't grown any more body parts, nor have I lost any. I got to be a breakthrough case, but I've taken the flu shot and got the flu before. So, I mean, nothing's 100%. Nothing ever said it was 100%. I can't hit a lotto ticket, but I'm sure and help become a breakthrough case. But I think we need to just educate. I'm not I don't think, as fractured as this item is, I don't think a mandate, I can't support, I'd have a hard time with a mandate because we have mask mandates and how are they working? So I don't know, but I think you guys are doing a great job. I appreciate you getting the extra testing out there today just the extra testing. I know we're going to set up a 2 different places in Honeydew this weekend, getting the word out there. So we are everywhere. It's just, you can lead a horse to water. So thanks, you guys.
Supervisor Wilson.
Thank you. I want to thank Supervisor Bohn for his point about the treatment that was, which was a good question from Supervisor Madrone, but the treatment's still staff intensive, right? If a person gets vaccinated, their likelihood drops by an order of magnitude to require that treatment. So it's still so much simpler to get a vaccination than it is to get that treatment. And on that note, I was so surprised to hear that locally there are folks actually seeking this treatment of some kind of deworming, veterinary horse deworming medicine that I thought was something popular somewhere else. It turns out people are doing that here too. Again, just the workaround is so much more complicated and dangerous than the solution that's just right in front of you, and so it's just one of those situations. It's discouraging to say the least on a lot of levels. And I'm hoping that I guess we're going to have some education around this use of a veterinary supplement or whatever, deworming. Again, but something's gotta happen with that, because I just find that just shocking, and any place that distributes that needs to definitely have, ask folks, please, or at least put up a warning or something. We really need some education on that, if that's really as bad as what I'm hearing from some folks. So masking is definitely working for sure, and especially in close environments and in enclosed areas. We're just the numbers are reflecting that, and so I'm asking, and no one wants to do it. I don't think that's not really the issue. I mean, very few people are really excited about putting on a mask, but nonetheless, they're more excited about not getting sick or getting other people sick. So those are my basic comments for now, and then happy to hear what the public has to say.
Thank you, Supervisor Wilson. And I learned something I don't think I wanted to know about that one treatment. Can't imagine people doing that. All right, we are going to public comment. I do not have any hands up at this moment. If you wish to comment on this item, press *9. And hopefully you're listening lifetime on the phone, so you hear me say that. I'll wait a few more seconds. Oh, all righty. All right, we have 0326. Press *6 to unmute.
My name is Genevieve. I heard all this commenting about testing and the effective of vaccine. Do we see all the 1,200 people die from the vaccine? So it's still called effective and safe. Nobody's comment about that. And also, you need to build your immunity up. That's a very common sense. Stay well, build your immunity up, instead of keep talking about the vaccine. We saw vaccine. CDC say the vaccine people still carry the virus and also infected people. So why keep pushing the vaccine? You need to build your immunity up. That's the bottom line. And testing is not effective either. If you don't have symptoms, if you have symptoms, stay home and get better. Testing, you're just causing the, what you mean is you are incriminate yourself. Bottom line, you should emphasize, increase your immunity, take your vitamin D, and also plenty of sleep, and watch your personal hygiene. That's the bottom line. We see people, I have neighbor, I don't care if it's FDA approved. My neighbor 2 months ago took the vaccine, she still don't walk well. That's the common sense. That's my education. Even though I know I read about everywhere. Even the 5,000, the frontline doctor talk about the vaccine, not even a vaccine, it's experimental. Political reason, they approve it. But you still have people dying. Pilot died, and people have 150 of students have enlarged heart. We see and we hear. We know what the problem. Don't keep saying that. And you know people are vaccinated is still transmitting a symptom carrier. So stop the transmission. Build your immunity up. I keep saying, first shot will decrease your 15% of immunity. Second shot, 35%. So stay away from the third shot. I had people have liver transplant, and then they were hanging there for 30 years. After the 2 shot, die. Another person wanted to go to Kauai, so she took the vaccine, whatever so-called vaccine. 3 days later, die. And please don't advise pregnant women take the vaccine. 2 people had miscarriage from the flu shot. One doctor, 18 weeks pregnant, took the shot because of advice, frontline person, she lost the baby. And now we advise people pregnant and take the shot. That's ridiculous. Don't drive. You won't have a car accident. It's the same thing about flu shot. They never experience a flu shot on pregnant women. Thank you. Okay, stay well.
Thank you. All right, I see no other hands up. *9 to raise your hand. And okay, this will be the last speaker unless more call in. The person I'm going to now. We have 1 hand up. If you're going to talk, anyone else, do the *9 now so that we know you're there. So we do have 6556. So we'll go to you. And you have 3 minutes. Press *6 to unmute. There you welcome.
Hello, my name is Sherry, and I'm really tired of all the disinformation like that last caller. That's crazy. There's so many voices coming out, many people with so much disinformation that we need more true information. We need to start enforcing these masks. I'm also hearing, oh, it's so hard. Coddle these people. No, enforcement. We need, hire security guard. Really, let's get real. Let's get serious. Let's take care of ourselves. The disinformation people are hurting us, hurting our community. It's so unbelievable, just unbelievable. We need enforcement. We need to stop coddling this. We need to treat it like the serious problem that it is. People need to hear the truth over and over, loud and clear. I don't know how long school's going to happen at this rate. Scare people a little bit, maybe. I think. I don't know. Okay, bye.
All right, thank you, Sherry. And we have 5300. Press *6 to unmute, and you'll have 3 minutes. All right, 5300. Press *6. There you go. Welcome.
Hello, this is Adam Lustig. I am a registered voter here in District 4. We've all communicated via email. The first thing I'd like to do is actually thank Dr. Hoffman for working on the monoclonal antibodies and also for educating everyone, including Supervisor Madrone, that they are in fact an effective treatment when used early. And many places around the country are using them with great success, including people I know. If you get in there early and get them, symptoms tend to go away within a few hours is all the reports that I have received. And then I just want to address all this misinformation. Like Forbes put out an article. The Pfizer vaccine in Israel, the world's largest trial for the Pfizer vaccine, one of the most vaccinated places in the world, is showing 39% efficacy. So we keep giving information that's weeks behind. So this thing that the vaccine is going to solve all our problems is just not true. So looking at these monoclonal antibodies and looking at other treatments, we can start saving people. And this thing about ivermectin, okay, the reason people got to get it at the feed store is because the human version that's been approved for 50 years is being suppressed. Pharmacies won't even fill the prescriptions. We have data from around the world, including huge data from India, showing the effectiveness of ivermectin. Now, I have asked, and I already know that you're receiving funds, federal, state, and private, to promote vaccination. I have asked, please let us see all the documents pertaining to these funds so we can see what you promised. Obviously, there's strings attached anytime there's money. And to sit here and hear you all push this vaccine and act like it's the only thing, it's disturbing. And you want to wonder why 45% of us aren't getting vaccinated? It's this kind of stuff. It's when we're told that, oh, we can't report underlying conditions or vaccination status or prior infection data because that's private, but then you do when it fits your narrative. Also, this unvaccinated versus vaccinated thing, okay? The unvaccinated includes partially vaccinated. It also includes unknown vaccination status. So those numbers aren't quite correct. And the shortage of workers at the hospital are driven by the vaccine mandates. I sent you a letter from Siskiyou County. They sent it to the state, the Board of Supervisors, questioning these mandates. If you want to solve the problem with nursing, you should really look at these mandates. And the concept that people that don't want to choose your recommended medical treatment should be somehow treated as second-class citizens and fired from their job or not allowed to attend university or to enter into a building, that's insane. That is psychotic authoritarianism. So this is the place that we ban GMO crops.
Thank you, Adam. Okay, that is the last public speaker, so we'll go back to the board, and I do believe Supervisor Bohn has his hand up.
I'm good. I'm good.
Okay, any other supervisors have a question or comment before we let these guys go and go about their busy work that we know they're buried under. So thank you guys for being here with us today. And one of these days, hopefully we'll get this back on just the consent calendar, but it's pretty important right now, I think, to have the discussions when we can. So thank you for that.
Well, thank you for having us here. And as always, we really appreciate the support of this board and the community. And yeah, thanks for giving us the opportunity to address everyone.
Thanks, you guys. So my next question, acting Ms. Hayes, it is 10:24. We have one item pulled off the consent calendar that I don't think is going to be done in 6 minutes. So I would just kind of want to ask your opinion, because I'm not sure with the time set if it's set because that is the one time someone's available. I'm just curious where I would like your suggestion. I don't want to leave someone waiting for a very long time.
Yeah, I do think the item pulled from consent may take a minute, and also the time set at 10:30 has been relayed to all of the necessary parties. Maybe we could move to the closed session item that we have and clear that up. I don't think that that's going to take more than
5 minutes.
I don't think so. Jefferson, do you have any thoughts on moving to the closed session for a brief moment?
I mean,
I do think that would work.
Think so? That's always the famous words. Okay, so we'll go to which time, which closed session is that? And then this, for those of you who are wanting to be involved in the conversation on D9, it will be happening after our 10:30 time set, because that's a pretty big thing we have to get off our plate.
Why don't we just take, oh, sorry.
What? Go ahead.
I was just wondering, why don't we just take 5 minutes and then go into the time set? What, I don't understand.
You mean
We're
a
never
break?
going to make it back in time.
Okay, that's fine. I mean, I don't care either. We can just do the closed session after that. I'll find 5-minute break. We won't get much done in 5. I agree with you in our most likely.
Yeah.
So we'll be back here at 10:30 to start the time set.
Thank you.
For our time set item, it comes to us from Human Resources, and it's regarding operational, excuse me, and realignment of payroll operations from Human Resources to the Office of the Auditor Controller. And so there's a team to present this. I'll take it away.
Good morning, Madam Chair, honorable board members. Thank you for the opportunity to be here with you this morning. Joining me in this presentation will be the Honorable Auditor Controller Karen Paz Dominguez and Mr. Scott Johnson, partners of the MGO. With your permission, Chair, I would like to share the screen.
Yes, please.
Thank you. Can you all see the presentation?
Yes, I believe so.
All right, I will put it to slideshow. The item before your board this morning is to discuss the operational realignment of the payroll function. Staff has prepared the following presentations to discuss the background, the staffing study work plan, the analysis of the peer county agencies, the lesson learned from the ADP business process mapping, the best practices that we have discovered through our subject matter expertise and business processes, as well as our peer agency review, the discussions of the options as presented in the staff report, and the recommendations option 1 before your board this morning. By way of a background, in November 2020, through your board special meeting, your board directed my office to return to your board to discuss about the classification work, the operations alignments, the recommendations, the analysis of various staffing studies. And all of this is part of the organizational change management endeavor by your board. Ultimately, in December 2008, December 8th of 2020, your board approved the professional services agreement with Macias Genie O'Connell, MGO. Various scopes of work through that professional agreement is a scope of work regarding the comprehensive staffing study for the Office of the Auditor Controller. And the objective of the comprehensive staffing study is my way as an attempt to be strategic in the transformations approach of staffing challenge through the examinations of the work departments, the structure, the classifications review, to address long-term and sustainable solutions. Ultimately, I returned to your board in January of 2021 with a presentations regarding the organizational-wide operational realignment and to request the various job classifications and positions allocations to the Office of the Auditor Controller, in addition to the comprehensive staffing study, as a way to look at long-term sustainable solutions for that office. Through the work with MGO, we have conducted a 12 comparator agencies. The review indicates that 10 of the 12 counties that we study with corresponding Auditor Controller's office has payroll resides in the Auditor Controller's office. We've also conducted a statewide survey. 49 counties responded for a total response rate of 85%. Of the 49 counties, all 48 counties has payroll functions reside in the Auditor Controller's office. We've also looked at the lesson learned from the ADP business process mapping, including staffing capacities, and the need for the collaborations efforts during that project. The other set of data point that we made through this discovery was that there was 2 management letters from our external auditors calling out in June of 2019 and September of 2020 of the segregations of duties and the lack of control in payroll as part of the internal controls, which is a huge risk. Another set of data points is the observations from the civil grand jury reports in 2019, also confirming the lack of control, including proper segregations of duties, such as HR processing payroll, while also processing salaries and wage adjustment. I'd like to turn his presentations over to Mr. Scott Johnson to talk about the staffing study work plan.
Thank you, Director Lee. So moving on this, as Director Lee noted, MGO was tasked to conduct a comprehensive staffing study of the Auditor Controller's Office. First, we developed an understanding of the Auditor Controller operations. We looked at the structure, we looked at the job classifications, the job duties, and the organizational functions that the Auditor Controller performs. Then, as was noted, we identified other agencies, the 12 peer county agencies that the county typically uses when the county is benchmarking with other counties. We looked at those 12 peer county agencies that had like complexity and size to the county of Humboldt. In addition, we reviewed the classification job descriptions and the duties from the peer county agencies. And then we interviewed the existing Auditor Controller staff, as well as the staff in human resources as it relates to the payroll functions. We then developed a matrix, and that matrix showed the competencies of the Auditor Controller staff, and we compared the competencies of the peer county agencies. We then developed, as Director Lee pointed out, through the ADP project that the county has decided to go a different way, but however, there were a number of processes that we documented, the payroll business flows. We looked at the internal controls and we documented the internal controls, and we made relevant recommendations as it relates to business process and the internal control structure as it relates to payroll. So I also want to point out that we are not yet complete with our staffing study. And there's a number of reasons for that. First of all, this observation, after we looked at the peer county agencies, their functionality, their duties that they perform, and we compared it to the county. And then after conducting the survey, as Ms. Lee pointed out, in addition, there are several new staff that have been hired by the Auditor Controller's Office, and they've been trained or in the process of being trained. And finally, MGO, through our firm, we have a team of members that are tasked with assisting the Auditor Controller on a number of functions to get caught up on things such as processing journal entries, doing fund reconciliations, and bank reconciliations. So because of all that, we have kind of pivoted in regards to this making this recommendation because of the issues that Linda had already pointed out previously, and because of the fact that things are getting caught up in that office, new staff, we're assisting in reducing the backlog on work that needs to be completed. So going to the next slide. We mentioned some of the lessons learned. And as Linda mentioned, some of the ADP did add some value to the countywide in working on the project, although there is a different direction that the county is considering. First, some of those lessons were to reduce duplication of effort and redundancies. Secondly, the need to assess and refine the processes, the policies and procedures as it relate to payroll. Also to analyze those internal controls, as we mentioned earlier, including the separation of duties. As Ms. Lee pointed out, the civil grand jury brought this up in a grand jury report. Your external auditor brought it up in regards to separation of duties. And me professionally, after 25 years working in fiscal operations, I had some concerns about the lack of appropriate separation of duty with staff working on processing payroll and also conducting other duties in HR. In addition, there's the need for assessing and monitoring access control. So looking at the staff that are assigned to work in particular areas within the system to make sure that there's not a conflict of interest, or there could be an opportunity for potential fraud, waste, and abuse based on what access staff is getting into the system and what modules and what functionality that they have access to. In addition, we noted that there was a need for further supervision and review of data input. Throughout the process, we identified that there were multiple data errors that created payroll processing challenges. So the team has learned that there is a need for greater supervision and more review of data input through multiple levels. And then finally, we identified where there is a need to have an accounting systems analyst that would reside in the auditor controller's office. That would really be vital in assisting the finance and payroll system issues while coordinating directly with central IT. Now, this model resides in other counties in the auditor controller's office based on our peer review, and also in my professional career and working with other public agencies, working as a finance director, working as a controller treasurer. I had the pleasure of having accounting system analysts that had the skill sets of both the understanding of accounting as well as technology. But those positions would also have a dotted line reporting relationship with the central IT department within the agency. Finally, I just want to briefly go over some best practices. Another reason why we're making this recommendation is that it's vital that the subject matter expertise be aligned with the duties performed. For example, in HR, typical HR functions, HR will be processing benefits administration and managing the benefits throughout the county for the staff and the employees of the county. They're also responsible for position control. They're responsible for talent acquisition, recruitments, retention, classifications and comp, organizational development, performance management. Other areas are the direct interface with employees, including employee confidentiality issues. They also manage employee leaves, labor laws and MOUs, promotions, terminations, and retirements. Much of these responsibilities, there will be touch points in your HR payroll system. And so that's why the mention of appropriate separation of duties and internal controls is really key. And moving on to the auditor controller's office. The auditor controller office typically will have the subject matter expertise for all accounting matters countywide, including the payroll functions. They're more in tune with the tax and audit requirements. They understand the need for strong internal controls and separation of duties. They're better aligned and they're subject matter experts when they're dealing with regulatory payments and regulatory bodies such as the Internal Revenue Agency and the reporting requirements that relate to payroll. So with that, I think it's very important to recognize that based on the data that Director Lee pointed out related to the survey and related to the peer agency review that we conducted, that it's by no accident that the payroll processing functions reside in the finance department, or in the county's case, in the auditor controller's office. It's by design. is because of the subject matter expertise of the respective departments and their respective roles and responsibilities within the organization. And now I'd like to turn it back over to Director Lee.
Thank you, Mr. Johnson. In the staff report, staff made 3 recommendations or 3 options recommendations to your board. I'd like to take a few minutes just to briefly touch upon the various options. Option 1, based on the design, and again, the 5 data points pointed out to your board regarding the internal risk, segregations of duties, the county surveys, the peer agencies, the management report, the external audits, and the civil grand jury report, all led to us making the recommendation that option 1, that payroll function placement should be in the office of the auditor controller. Primarily, not just only to align subject matter expertise in our roles and our responsibilities, but it will also allow HR to focus on talent acquisitions, labor relations, organizational management, risk management, and in the last 18 months, rapid response to COVID-19. Again, to ensure proper internal controls, that is the key. And I like to take a step back here to why the internal control is very important. When I came on board 16 months ago, unbeknownst to me, yes, payroll is in the human resources department. But with 2 consecutive years of the management report, the management letter from our external auditors indicating that there is a greater need, a potential risk if we don't address the proper internal controls, I truly believe it is my professional recommendations that I, as the director of the department, also make an effort to address any corrective action as a result of the audit's finding. So by doing this, it is my way of saying that I am taking seriously of the action of the findings, the recommendations from the external audits, and to ensure that we have proper protocols in place. There is no perfect infrastructure in human resource management. But what I'm looking for here is to make progress that will modernize the human resources continuum effort to serve the community and to serve the workforce. Some of the other options or benefits of option 1 is to really clarify the roles and responsibilities required from both offices. An opportunity for us to ensure that we are in compliance with the state, with the federal report timelines and filings, such as the compensation report, the W-2s, the tax filings, both at the state and federal level. Also, an opportunity for us to reconcile on a timely basis of W-2 wages on an annual basis. These are the things that, as of this moment, I can say that I, in my department, may not been doing this on a regular basis because, quite frankly, this is a subject matter expertise that rely and reside with the auditor controllers. We provide the input, the auditor controllers provide the output. Oftentimes, those sequence needs to coordinate and collaborate. Option 2 is taking option 1 recommendations, but to implement it with a 6-month pilot demonstration. The 6-month here is to continue the integration partnership, to strengthen the working relationship between the 2 offices, and also to create more of a transparencies in the business efforts as we move down the path of tightening the roles and responsibility, clarifying the transparency, as well as implementing internal controls. But the disadvantages of option 2 is that with a 6-month term pilot demonstrations, the continuity of that teamwork, that energies, all of this is upfront, then the impact of the 6 months, you will probably have loss of those learning skill set. The disruptions in the business continuities between the 2 offices during this trial implementations. And the loss of opportunity to really look at untimely processing of payrolls due to lack of payroll staff in HR. In the last 16 months, Human Resources Payroll has operating fully on extra help staff with 2 key team members. In March of this year, we have 1 key team member resigning from the workforce. Early in July, I have 1 key team member who is not available. And we have been operating by using our extra help staff. They are key to the survival of these operations, but they're learning the continuities of that has been very disruptive. I've also reached out to many department heads, providing key supports to my department. And for that, I am extremely grateful and thankful for their tremendous support in lending staff. But the payroll process doesn't end by just pulling in the data and completing at the end. There are many reconciliations, corrections that we have to do on a regular basis. Option 3, should your board continue to place payroll functions in County Human Resources Department, there will be an opportunity for my human resources staff to become a subject matter expertise in accounting. But we do need additional staff that has that mindset to help complement the personnel analyst and the rest of my staff to understand the internal controls. There is going to be an attempt for us to introduce and to implement proper segregations of duties between the payroll functions and the human resources personnel transactions within my department. I'd like to take a step back here. With 25 years in public service, I am accustomed to have a strong internal proper control. In my past experience, human resources serve a multi-level. One, as a stewardship of the 21st century best business practices in human resources management. It is about consulting, it is about strategic framework, it is about transformational. But at the back end of that human resource management, we also provide transactional services, which is processing new hires, processing retirement, processing separations, processing leaves. All of those are transactions, and I have to ensure that anytime that we have a touch point on the personnel side, we need to have separate staff and to build a firewalls in between the payroll side and the personnel side. With option 3, if your board approves with the additional staffing for my department, then I can move forward, implement those separations of duties and to ensure proper controls. However, the disadvantage of option 3 continue is that we will continue to have increased additional funding and allocation to support my department. We will continue to see the duplications of efforts and the redundancies. Because payroll still reside here, we still have to have the touch point. We still have the connections with the auditor controllers at the output of the continuum strength of human resource and payroll processing. We will continue to work in silo. However, I'd like to make us pause here. Within the last couple of weeks of our interactions and collaborations, coordinations, and really key friend partnership upfront, we were able to minimize a lot of redundancies and duplications of efforts. But that doesn't mean giving me additional staff that will stop. No, we will continue to have that partnership. But again, the business efficiency is not there. We will continue to have duplicate in touch points. We will continue to have poor internal customer service. As currently is, any payroll cycle, when there's a questions coming in from an employee, what about my paycheck? Naturally, it will gravitate the employee to call human resources. When we look into the data, then we say, I'm sorry, that is not within payroll. It is a question for you to refer to the auditor controller's office. When it gets to the auditor controller's office, when we look into the deeper of the system said, no, the information is now residing in payroll. So that toggling back and forth is ineffective and is poor customer service to our employees. We will continue to have lack of internal controls within the AC during the issuance of payroll payments. If we were to disconnect the front end, What that means is that the front end has to have happened before the back end can take place. And right now, the payroll function is fragmented between the two departments. I'd like to turn this over to kind of share with you the real live practicum that the auditor controller and myself have implemented in the last 4 to 5 weeks due to staffing changes. A very key important team members of mine is not available. And how do I move forward to ensure that payroll is being generated on a weekly, bi-weekly basis and timely and correctly? We implemented a pilot integration partnership. I quickly called for a meeting with the Auditor Controller's Office and her designees, the county IT team with his designee, and then from HR payroll, my team and my payroll staff. 5 Mondays ago, we talked about what is this integration will look like. So we began the conversations. We are looking at how do we move forward to provide business continuity, and what are the staffing constraints facing HR at that critical moment, and how are we going to be able to meet the first payroll cycle without our key team members. I'm going to turn this over to the Auditor Controllers so she can talk about the real life practicum that we went through in the last 5 Mondays. Thank you.
Thank you very much, Director Lee. Good morning, supervisors and department heads. It was almost 5 weeks ago when Director Lee communicated with my department that there was a critical need for us to assist, to step in and help with the processing of payroll due to the loss of the key staff. What we did is we called together a meeting that included the HR staff, auditor controller staff, and county IT staff. And via Zoom, we shared our screens and we developed a spreadsheet that outlined step by step the life cycle of a payroll transaction, beginning from when a new person is hired and their profile is created in the finance enterprise, all the way through to when we finally issue their paycheck. We went step by step identifying what is this step called, why do we do it, who currently does it, if that person is not here, who can cover, who's already been cross-trained, how often does this task need to be performed, and by when is it due? And it took several hours for us to map out line by line each of the steps. But in doing so, we were able to identify weak areas where we didn't have any cross-training, weak areas where we maybe were skipping a step that was critical to the process of payroll. And that inspired us to continue this teamwork by then cross-training each other. So Human Resources invited auditor controller staff to watch and shadow while they performed their payroll function. Similarly, auditor controller staff invited staff over and they observed us as we processed the payroll function on our side. What that assisted us in doing is further developing our standard operating procedures. We realized that our instructional sets, our instructional documents were not complete or maybe outdated. And so on both sides, we were able to update our instructions and become better experts about our own processes while also understanding what our partner departments are also doing on their end. Luckily for us, because we were able to have that first initial meeting on that Monday, we were prepared for what we had to face that next Tuesday. There was a glitch in the payroll system that caused the payroll file to go out of balance. This was a very dangerous situation because it potentially could have stopped us from issuing payroll timely. But because we had established that communication and collaboration, we were able to call all hands on deck and we identified where the error was. We were able to use IT's expertise, auditor controller expertise, and payroll expertise in human resources to find that one entry that was missing just 4 numbers in it. And because we found that entry, we fixed it. We were able to test the payroll again, run the payroll again. And even though we stayed till 11 o'clock at night, we were able to resolve it and we were able to issue payroll timely. That inspired us to continue that collaboration. And now we have weekly check-ins. Every Monday, we check in all of our teams to make sure that we're on the same page about what is expected in this week's payroll, whether it's a main payroll cycle or a supplemental payroll cycle. We're able to communicate as we work through the process to ensure that if there are any glitches in the system or any issues that we face, we can all jump on right away and we don't lose any time. We're promoting efficiency and improving our own education and collaboration. Something else that we've done together, because we recognize how closely the Human Resources Department and the Auditor Controller Department have to work to ensure the success of payroll, is Director Lee and I participated in joint recruitment and joint interviews for these key positions. We were able to identify what are the skill sets required, what are the personalities that we need to see that will be able to be the bridge between both departments. And we were lucky that we made a selection. Because of the success of this partnership, we now have a good model to follow for future recruitments and future all hands on deck situations. Regardless of which direction the board chooses to go today, I am proud of the work that we've done. I'm proud of the empowerment that we've given to our staff who are performing these tasks. And I am very grateful to Director Lee and to Mr. Johnson for helping us get to this point. I am excited to see where we can go now. And I believe we are modeling the behavior we want to see across the county. We're going to keep building upon this partnership. We're going to keep conducting these crosswalks. We're going to keep improving our instructional documents so that we can then start sharing them with the rest of the county.
Director Lee?
Yes.
Yeah, I just wanted to add some commentary as your independent consultant and my 25 years of experience in operations in finance and administration. I've been an executive project sponsor for several HR payroll system implementations and also primary responsibility for the payroll processing for a very large part of my career. And what I want to mention here is that these elements that you have listed on this slide, you know, the crosswalk of the roles and responsibilities, backup resources, cross-training, job shadowing, weekly check-ins with the team, and then working together on determining the appropriate fit in the organization with the appropriate skill sets related to staff. These are all elements of success. These are best practices in the industry. And so whatever the board decides to do today, I want to reiterate that these elements need to continue. These elements did not reside before the pilot integration partnership was formed between HR and the Auditor Controller's Office. There is real concern and real risk for a mission critical system like payroll with the staffing constraints that you had, and you did not have the breadth of experience and knowledge and related backup if there were risks in processing payroll. So I think it's really important to point that out. And I'm just giving you my independent perspective on it. Thank you.
And thank you. Through the chair, I would also like to add my personal observation. Having been with the county here almost for 16 months, I would like to say that 16 months ago, we did not have this close collaborations and coordinations and this check-in to ensure the projections of processes, you know, how do we impact the front end of payroll versus the back end of payroll? Our communications was largely due to email communication. Ultimately, that now leads into more of an open communications. And the weekly check-in has really developed a team partnership between the two offices to fully understand how we impact our process to the other side. And that cross-functional support is so critical for any success of this magnitude. I also like to impress upon your board that since implementing this integration partnership 5 weeks ago, It was the very first payroll cycle that we had little errors or minor corrections. It went smoothly because there was an open communication. There was that trust, that empowerment, that collaborations, that coordinations, understanding what we touch on our end will be supported on the other end by the Auditor Controller's Office and vice versa. And for that, I'm very grateful to my entire team who stepped up, who really stepped up for the entire county and put their heart into every single pay period, getting a lot of phone calls from unhappy employees, naturally, rightly so, if there is a miscalculations, but they were unwavered. They move forward and they believe that there is going to be a coordinations, a collaborations. And in the last 5 weeks, I've also witnessed the collaborations with IT. Our 2 IT technicians were wonderfully to be there to support us on both sides. And I continue to impress upon this weekly check-in because I am now responsible for the front end. I can anticipate and project the number of transactions that will also help communicate to the team what would be that workload impact look like by the time we turn the data over to the auditor controllers so that we can timely meet the checks payments for the IRS, for EDD, and then ultimately the payments to our employees. So we would like to share with you this real life practicum that currently have been in place in the last 5 weeks. And so based on the real life experience, the 5 set of data points, the independent analysis, the peers reviews, the best practices, it is our recommendation before your board to adopt recommendation option 1, which is to place payroll functions in the Auditor Controller's Office. Mainly, this is due to the business sensibility, the organizational effectiveness and efficiencies, the value added to the internal customer service, the alignment of industry standards in internal controls and other organizational best practices. We humbly ask your board to transfer payroll functions from my department to the Auditor Controller's Office effective September 5th. And this date was is not selected. It was again by design so that we have at least the full month to do this transitions and to work out with the teams, but ultimately to ensure that we are in alignment with the IRS filings and the quarterly filings so that there is a smooth transitions of those quarterly regulatory compliance. We are requesting your board to deallocate 3 positions from my department and transfer those positions to the Auditor Controller's Office. To support the success of these functions, we are also requesting your board to allocate an additional 1 FTE of a payroll services manager in the Auditor Controller's Office. We've also requesting with your board approval to allocate 1 FTE of the accounting system analyst in the Auditor Controller's Office. And we will be we are committed to the success of these transitions. We will be coming to your board with a progress report to the county's audit committees in early 2022 on the payroll function realignment. I would like to make a pause here to make a correction. It was pointed out to me by the county administrative office that because my calculations, the budget transfer projections was based on a 12 month, we are now entering into third month of the fiscal year. So if there is going to be any appropriations, recommendations, or changes, I am more than happy to return to your board midterm to make those budget recommendation changes. So I would like to clarify that.
The next step. The offices of the Auditor Controller, Human Resources, and County IT are committed to do the following. We're going to conduct a business process meeting to continue to map out the roles and responsibilities. Who is responsible for what? How will it be performed? Who can assist? We're going to continue to participate in joint selection interviews for the recruitments of the key approved allocations and classifications. That means that auditor controller and human resources will jointly select payroll specialists. The auditor controller and IT will jointly select the accounting systems analysts to ensure success in a liaison capacity for these positions so that all departments continue to work cohesively. And we are committed to develop a memorandum of understanding, an MOU, of agreed upon roles and responsibilities. We intend to memorialize this so that we're all on the same page for years to come. Our long-term plan, we will establish a steering committee to evaluate Finance Enterprise, which is our existing financial software. We're going to evaluate it as the county's enterprise resource planning software solution that allows county-wide integration of the core operations, functions, and processes for payroll, accounting, human resources, and all of the other modules that go along with it. We intend to return to the board with a status report on the potential use of Finance Enterprise as the long-term solution, or either a recommendation for another potential ERP option for consideration. We will keep the board in the loop, so to speak. We want this to be an open and collaborative process for all of us.
And with that concludes our presentations to your board. Before we open up to your board for questions with staff, I would like to take this time to first acknowledge the wonderful work of my entire HR payroll team. I've witnessed many challenges, many struggles. I walk along with them every step of the way in the last 16 months. But I would have to say, from a 50,000-foot level, it amazed me the various intricate steps that they would have to endure to process timely payrolls for the entire county workforce. I would also like to take this time to express my deepest gratitude and thankfulness to the entire county department heads for their unwavering support in the last 16 months, recognizing that in the face of COVID and many other challenges in HR, we pivot where we can, and they allow us, and their patience kept us going. I would like to express my deepest appreciations to Sheriff Hansel for lending us some of his key staff member during the ADP project transition so that we can also have staff be available to help support the real life payroll function. And also to Director Beck for reaching out, for assisting, and also to Chief Probation Officer Branneman for helping us during this key critical times, which is doing spot checks with staff. Without those key critical supports behind the scenes, the front facings of payroll functions would be very difficult. But the project before your board here, I have to say that I do not anticipate any front-facing challenges for our departments in the current structure. All of this realignment is for the back end to realign the proper controls, the separations of duties, and to align the subject matter expertise. And like the auditor controllers indicating, the long-term plan is that what is the right ERP solutions? We look forward to have the conversations with the key team across the board. Through that conversations, I am hopeful that we will be able to have a very strong, robust ERP system. So with that, we conclude our presentations, and with the chair approval, I'd like to stop share so we can all come back.
Yes, please. All right, well, thank you for a very thorough presentation. Sorry, I'm computer difficulties today. So I suspect there are probably some questions from board members, or actually, if any staff is on here, whoever's on our Zoom, please, Supervisor Bohn.
Well, I've got a lot of them because we've got a lot of correspondence, and it's especially correspondence from all those people you just thanked for helping you through the transition, and their concerns are extreme. And I don't know if you've seen that letter from yesterday, from Public Works, DHHS, sheriffs, probation. I guess this would be directed at Director Lee. And then the other thing is as I'm going through this, where is the current payroll manager ending up in the 13-year, the manager we've had over there in payroll for 13 years? Is she gone? I know she's not working right now, but I don't see her mixed into this. And I know Scott Johnson was the subject matter expertise. And I don't think anybody, the old payroll team's even working for the county anymore. And I don't know where the subject matter expertise is. That's a couple easy ones right now.
Yes, through the chair. Thank you, Supervisor Bohn, for your thoughtful questions. I would like to address question number 1. It is customary for HR to always express appreciations to key team members and key players. And I do mean that from the bottom of my heart, for all of those individual staff members that really have came over to assist our payroll processing in the current state. No matter how fragmented or disruptive it was again, all hands on deck, spot training, doing the best we can to meet those biweekly payroll. And yes, I have receipt of the letter. I wish to address that letter from my professional perspective. As I said in my presentations, the front-facing or the public interface here with the 19 departments do not change. Just because we are requesting to reallocate those key payroll specialist positions back to the auditor controllers, the functions still continue as is. I will continue to partner with the auditor controllers from the front end, which is processing timely merit increase, completing payroll transactions that impact salaries, compensations, and a variety of other tasks relating to human resources side. With respect to the current incumbent payroll services manager, the manager will continue to be reporting to HR. Her knowledge is critical for us to transition into this proper firewall of internal control. She is knowledgeable in finance enterprise, and there's a variety of responsibilities that we have not been truly able to complete, such as effective control, position control management, compensation tables that we need to update, salary changes that we need to ensure that we are in compliance with CalPERS. The incumbent will remain under Human Resource Management Office. I would like to qualify here too is that I did have a conversations with the incumbent. The incumbent is fully supportive of this transition. It makes sense operationally, firewalls, internal controls, but it's also an opportunity for the incumbent to learn a variety of tasks in human resource management that will only add value to her skill set, which is critical and very highly regarded by me. And so I just want to make sure that everyone is aware of that. The incumbent is not going anywhere.
I hope you're right. That's not what I got when I talked to her this morning, but maybe she's just so everybody knows that too. Thank you.
Thank you for that clarification. Thank you for that clarification, Supervisor Bohn. I was not aware of that, but thank you.
All right. Did you have any others you wanted to ask Supervisor Bohn at this time, or you can certainly go to others? Thank you. Thanks. All right. We do also have some department heads that I do see on here, so would like to invite you to weigh in as well, since this is a countywide piece of that they're trying to work on here. So, Director Beck, I see you took your, okay.
Yeah, so I was actually hoping that we would hear from Regina or others who wrote the letter, just because it is our payroll staff and our finance staff that have these worries that are brought forward. That letter did not come from myself or other department heads. We actually weren't made aware of the 5 weeks worth of cross-training that was happening or anything else around this payroll transition until Friday afternoon, right before the agenda was posted. So I think there's some huge lacking of collaboration that they're talking about there. So I just want to say that. I do stand with our payroll and finance staff with their recommendations and their worries about transitioning. In a perfect world, I think this makes sense, and it living in the auditor controller's office makes sense, but we're not living, our county government, our financial system is not living in a perfect world right now. I have a better understanding now that the auditor's been busy for the last 5 weeks, and that's why the information didn't get to the outside auditor to complete the financial audit that will be due September 30th. So that makes sense to me now. And actually department heads and finance staff haven't been able to actually meet with Karen or any staff in her office to talk about closeout. Besides the single audit not being done, I want to remind you that we could be in jeopardy of losing our federal and state funding because of that audit not being complete. We have grantors in public health that have been asking for this audit for some time. I was happy to hear that Scott Johnson had mentioned that he's helping the auditor's office get caught up on their duties. My finance staff have not seen that. We have journals that are back to December, no journals from December forward in fiscal year 2021. None have been posted. So that's over 300 journals totaling $74 million that hasn't been posted. Our second quarter adjusted claim is due next month, and we will be backing out $1.15 million of expenditures out of that claim if those journals are not posted. I could go on and on. I share this information with your board on a regular basis. I can't see us adding additional duties to an already overworked staff. I just don't even know how to tell you. Please hear our staff's voice in the letter and allow departments to be involved in this process. I'm not used to, as a department head responsible for half of the county employees, I'm not used to having absolutely no control over how folks get paid, if they get paid, if they're getting their benefits timely. I'm like, I'm super frustrated, and it's not okay that we have a couple of people, a couple of departments causing so much work for our staff without communication at all. No buy-in, no collaboration. So thank you for listening to my frustration, and I apologize for that.
I wanted to ask before I go to you, Sean, or maybe Scott, you may want to do this afterwards, because I did ask Scott in our conversation yesterday, what does catch up mean? And I think he's getting a broader idea of what might be lagging. So in the VIT staff, Scott, I would like to hear, after you hear this input, is this something you can help accomplish, or is this something that's longer term? But I'd like to go to Sean Brenneman first. I want to hear from the department heads who apparently wanted to I didn't see a letter this morning, so this is new. So
through the chair, it was a letter from our senior fiscal staff in various departments. It wasn't from department heads. I just saw it this morning as well. I guess my general concern is that, one, I would have thought something like this would have come from the CEO's office, and we would have a strategic discussion at a department and at a county level about how we'd respond to a particular crisis in payroll. Regardless of that, my question in that meeting, if that had occurred, would be around, similar to Connie's, is we have departments that are struggling to do basic financial processes. And our experience in the county has been that our fiscal processes have been behind, and we've been struggling to meet deadlines, and it's not functioning particularly well. At the same time, payroll has staffing issues and they're struggling. I'm not sure how we solve the problem by taking those two zones of control and put them into a place where they're not adequately staffed. I don't think this is going to solve the payroll problem. I don't disagree that maybe structurally, organizationally down the road, that would be a good time to move it, but it should be moved when they are adding resources to the audit controller's office, not where we would be drawing down resources to try to do basic payroll functions. If payroll was fully staffed and functioning well, and we moved it over to the auditor controller's office, I could see that, because it could actually provide support to that office if they were functioning well. But Director Lee is struggling to get her primary work done because of short staffing and other issues like that. And they're reaching out for resources as appropriate. I just don't see that this solves this problem in any way. And I think it puts stress on an already stressed out fiscal system, which causes me great concern. I want to make sure that our vendors are paid and our staff are paid. And I worry about, is this a solution that will get that done over the next 6 months? And I would have a lot of questions around that. And that's my comment. Thank you.
All right, Sean, Director Mattson.
Yeah, I'll weigh in on similar vein. The payroll actually does, in my mind, belong in the auditor controller's office, but she needs to have the resources to deal with it. If it comes at, dragging down her existing employees, that's going to hurt the county. So our plea is basically make sure that the appropriate resources are allocated when it goes to the auditor controller's office. Definitely move it back to the auditor controller's office. And please open up the collaboration to all of our finance managers. We hired them for a reason. They know the finances, right, left, up and down. They have the independence. I have full faith in my deputy director as to her skills. They just want to be included in what's going on, what changes are going on. So again, my plea is just to make sure that the appropriate resources are allocated to the auditor controller to be able to take on this function again.
Thank you. And Connie, you have a twin. I don't know if you know this. It's like now you had someone had your name on their thing. I'm going, don't confuse there.
Yeah. Actually, I think that's Regina Fuller.
Okay. No, that's fine. I was going, today feels like a Monday to me. I would just had to ask. Well, first, any other department heads that had wanted to weigh in? I thought I saw one more go on. Okay, so Regina, since we're discussing a letter, and I believe you sent it, I believe, according to Mrs. Supervisor Bohn?
Yes, correct.
Okay. Anything you wanted to add?
Yes, thank you very much, Chair Bass, esteemed Board of Supervisors, Director Lee, and Auditor Controller Paz Dominguez. I originally thought that I was only going to be able to speak at public comment, and I was just invited as a panelist. So thank you very much for this opportunity. After hearing today's presentation, I think that something that's very important that everyone hear is that as management confidential employees, deputy directors, managers, we have been kept completely in the dark. And we heard through rumor last week that there was a recommendation going to the Board of Supervisors that would move payroll back to the Auditor Controller's office. We did not see the full agenda item until almost 5 o'clock on Friday. And we have been frantically trying to put together a reply. I have to say that when we first heard this and we'd started our first draft, it was based on speculation, not having any idea that the auditor's office and human resources had been collaborating and looking through things with MGO to make such a beautiful presentation. I mean, it absolutely makes a ton of sense. I think Director Beck spoke it very clearly and very well that in a perfect world, this is where we would all love to be. And I have to say too, that I am incredibly pleased to hear that Human Resources and the Auditor Controller's Office have been working well together the last 5 weeks. So that is fabulous news. And I just truly wish that those of us other departments could have been part of this collaboration, could have been made known that this was happening and that a recommendation was being evaluated. Because I do believe that how things have played out for us over the last few days would have been very different. But because we were in the dark and we did not know what was going on, we gathered together with the limited information that we had, and we did write a letter. So with your permission, since there's been so much talk of this letter, I thought I would take a moment to read it so that everybody was on board. And again, please understand that this letter was written with very limited knowledge. And I do believe that our letter may have been written slightly differently had we had an understanding after hearing today's presentation. So with that said, here I go. So dear esteemed Board of Supervisors, Director Lee, and Auditor Controller Paz Dominguez, several middle management, administrative, payroll, and or fiscal staff from the Department of Health and Human Services, Probation Department, Public Defender's Office, Public Works, and the Sheriff's Office have come together to share our mutual concerns about the operational realignment of payroll operations and to offer an additional recommendation. Payroll is a critical shared service that directly impacts the daily work of our departments. We believe we have valuable insight, history, and expertise in our departments and would like to be part of the solution. We understand that leaving payroll with human resources may not be the best solution given the reasons discussed in the agenda item. Therefore, this is a difficult situation to resolve, and we empathize with the position that Human Resources, Payroll, and the Auditor Controller's Office are in. Although the operational realignment recommendation to move payroll back to the Auditor Controller's Office may make the most sense on paper, the current short staffing of the AC office makes this recommendation at this time deeply concerning. Currently, when staff email the AC office, they receive an automatic reply as follows. Due to countywide impacts of the ongoing coronavirus pandemic and our staffing capacity, our primary focus is on completing emergent, urgent, and essential office tasks. We understand that your inquiry is important, and we shall do our best to respond as soon as possible. We will respond to your inquiry at the earliest time possible, though response times may be longer than usual. Please note that phone messages received by our office will be returned after email messages. Our current experience is that it can take months to receive an answer to an inquiry. Furthermore, some departments are experiencing essential financial tasks like journal entries and interest postings being more than 6+ months behind. We are deeply concerned that since the AC's current staffing capacity has resulted in essential financial tasks being more than 6+ months behind, that moving a payroll division to the AC office when that payroll division is also short-staffed will only exacerbate an already difficult situation. Currently, several of our departments have provided staff resources to assist payroll during this difficult time, and we are willing to continue to do so until payroll staffing can be stabilized. Additionally, we believe it's time to assemble a board-appointed working group involving all county departments that wish to be involved to help support payroll during this difficult time and provide ideas for efficiency, process improvement, and be part of implementing those ideas. We are recommending that the board establish a working group to include a leader from Human Resources and Payroll, the auditor controller, the interim assistant CAO CFO, and staff from each county department that is interested in participating. The focus of the working group would be the following: evaluate how departments could further assist payroll until the payroll staffing positions are filled, evaluate the tasks and duties currently assigned to payroll to determine if some task duties could be centralized back to departments, improve efficiency of the workflow and tasks while also maintaining sufficient internal controls, improve automation workflow in finance enterprise, evaluate if the county should continue to look for other alternatives for payroll and time and attendance, or continue to utilize finance enterprise and ExecuTime. We are in strong support of the recommendation for the one accounting systems analyst to support finance enterprise. If approved, we hope that this position would be an integral part of the working group for payroll improvement and efficiency. We would also like to encourage the board to consider allocating financial resources to engage finance enterprise directly to assist in making modifications needed to the system to implement the process improvement and efficiency changes. Not only are there payroll and financial system improvement changes, but there are also reporting requests that our departments would like support with, and we are very interested in other finance enterprise modules like grants and contract management. In summary, we would like to offer our continued support to payroll through the establishment of a formal working group. We also hope that some other interim solution could be found to stabilize payroll and delay moving it to the AC office until such time that the AC staffing capacity has improved so that they can catch up with essential financial tasks and are able to respond to staff inquiries timely. Thank you very much for your consideration. And the people that have signed this is Yvonne Winter, Deputy Director of Employee Services for DHHS, Tammy Hunter, Payroll Personnel Supervisor from DHHS, Cindy Hammers, Supervising Staff Services Analyst from DHHS, Melissa Norton, Senior Payroll Personnel Specialist from DHHS, Alicia Hardison, Legal Office Business Manager from the Probation Department, Mitzi Whitley, Administrative Services Officer from the Probation Department, Marie Essig, Legal Office Business Manager from the Public Defender's Office, Charlotte Merkel, Deputy Public Works Director, General Services from Public Works, Katie Collender, Senior Administrative Analyst from the Sheriff's Office, Monica Fridley, Administrative Services Officer from the Sheriff's Office, and myself, Regina Fuller, Deputy Director of Administration from the Sheriff's Office. So with that, thank you very much for the opportunity to speak.
Thank you, Regina. Okay, so there's, we kind of questions from the board yet. We do have public comment as well. I don't see any hands going up from the board right yet. So I think I'll go to public comment. Oh, Supervisor Madrone.
Thank you, Madam Chair. Wow, a lot of water under the bridge here, right? It's been quite a whirlwind for the last couple of years here. Let me start out by thanking all of the folks that signed on to that letter. Yeah, the timing was a little off on all of that and such, and I can understand the frustration of not knowing about things till Friday. But when all hands are on deck for 5 weeks just to get payroll done, which has to get done, it's not something that can be delayed. It's not surprising to me that some other efforts and communication had to wait a little bit. That's pretty understandable to me, but I can understand the frustrations on the part of those folks. But what I really appreciated in that letter was a willingness to work together. That's what I see here today, is that we've really turned a corner here. And I think we all want to see a really functional payroll effort, as well as a functional auditor controller's office, human resources office, and all of our departments being fully functional, getting their paperwork done timely, and getting the money flowing to where it needs to be in a timely manner. And so really what I'm seeing here today is very exciting to me, in that it's an all hands on deck. And in that letter, there was a lot of offers of assistance to make sure that this process of transition goes smoothly. And I very, very much appreciate that. I want to thank the department staff for their willingness to do that. None of this is easy. I am very supportive of option one. I'm glad to see the recommendations for not only transferring staff, but adding some more staff, because I think really from the very beginning, even before the current auditor controller, there was requests from this department for additional staff in order to really be able to do this work. And I know we added some staff a while ago, but with COVID and people out for all kinds of different reasons, it's not like we actually really added any staff. We may have on paper, but that didn't actually happen in reality due to all the other things going on. So I'm really excited about getting the kind of staff in place that can really manage this and help all of us work together, the departments, the CAO's office, the county. And so I want to thank all of you for what I see as an incredibly difficult period of time we've gone through, and have come out the other end with what I think are very strong recommendations to move us all forward. So count me as somebody who's supporting that effort of moving forward together. And I look forward to public comment as we get to that point, as well as other board comments. So thank you.
Thank you, Supervisor Madrone. Supervisor Bushnell.
Thank you through the chair. I also would like to thank staff for the letter and the insight. And I had a couple questions, if I may, one for Director Lee and a few for Ms. Dominguez. Hi, Karen. I was wondering, so with the, you currently have one staff member that's a payroll person that's been a payroll supervisor, and why would she not be moving with payroll when she obviously has good experience?
Thank you, Supervisor Bushnell. I would like to take a step back. I was informed that in 2018, the transitions of the payroll functions out of the auditor controllers was a result of a staffing concern. Ultimately, those 4 positions, including the incumbents, came over to Human Resources Management. Since 2018 until now, we have quite a lot of resignations. 2 payroll specialists during the COVID is on leave. And finally, 1 person resigned, so we have 1 vacancy. 1 of the payroll specialists is still on the book, currently still on leave. The payroll supervisor that came over to HR in 2018 resigned in March of 2021. The recruitment is in place. We are unable to fill the positions because of the lack of qualifications in the application pool. We do have a payroll manager, and I wanted to capitalize on her resource, her knowledge, so that we can build on what I call an effective firewall. In terms of practicing position control management, that is something that our current human resource management infrastructure do not have in place. And I've spoken to the incumbent and received positive support from the incumbent of the potential recommendations of the payroll functions placements in the auditor controller's office. So unbeknownst to me, that may have changed, but prior to all of her being on leave, I did have conversations with her being supportive of that. And so that is why I wanted to ensure that with her knowledge, she can easily participate as part of a key team during this transition, but she will also be a value added to my team in terms of finance, enterprise, and position controls management and leaves benefits. That is the areas that we are lacking, and I wanted to ensure that I increase that protocols in that component. So to answer your questions, that's why we have the vacancies. In the last 5 months, since March, we have conducted several rounds of recruitment for payroll specialists. We have yielded 1 appointment. The payroll supervisor is basically ongoing right now. I truly believe that with all of these transitions, and I understand from the department heads, the concern here is that with 75% vacancy, basically, how do you bring that vacancy over to the auditor controllers? I do understand that, but we have been I'd like to take a step back to answer Director Speck's questions about this 5 weeks integration plan. How come there was no communications, no collaborations? And that's the reason why, because in the midst of payroll processing, we discovered that our payroll manager is unavailable. So we're on a time crunch trying to see how do we move forward to processing payroll and what is the back end will look like versus the front end. So we established that kind of a silo, very tight coordinated group to see what can we do to assist us. And because of that pilot integrations, we expanded out along with IT. And this recommendation also came from our IT director, Jim Storm, to increase that communication so that when we have the front end and the back end, if there's a system issues, IT could be behind the scenes 24/7 to push through the financial difficulties in our system. So because of all of those reasons, we are trying to identify what is the best course. And from an organizational change management, if you want to make a transition such as this, when you have vacancies in your positions, it would be ideal for the new incoming director to be able to make that selections, to start fresh with the team, to have that team synergy within that department. But I do understand the department's concerns, and I appreciate their they're really voicing this morning.
Thank you. I part of the staff recommendation is to hire additional staff to help the ACA's office, which you just kind of stated, but without what would be the difference that they wouldn't apply through you, that they would apply through her? And what if we don't get the extra help? And I guess I could direct this to Karen. You know, the concerns are that you have stated in the past that your office is very busy, and with some of your staff not working or not being trained, adding more items to your staff without having additional staff. If they're not available to hire, I don't know if they didn't apply 5 months ago, I don't know why we would get anybody in that pool to apply now. How would you address that without creating, I guess, more problems through your office? Or you know, you're going to have additional work. If you don't get additional staff, what do you anticipate seeing happening?
Thank you, Supervisor Bushnell. I believe there are several questions in one, and I'm going to try to break them apart a little bit. So the first one I heard was, what's the difference between allocating these staff, filling the vacancies in the Auditor Controller Department versus filling the vacancies in HR? And the difference is in who has the ability to train that staff. So as our presentation showed and demonstrated, there is expertise required when it comes to payroll and its related accounting functions. If they come to the Auditor Controller Department, we are able to train them on finance, on payroll, on tax, on audit, on regulatory reporting. If they go to HR, as Director Lee has expressed, there is no subject matter expertise there to train those staff. So what it would result in is Auditor Controller having to fill in. That was one of the disadvantages that we identified in our presentation, is that I would be pulled from my operations to assist in training that new staff in human resources. Yes.
Can I ask a question with that statement? More of my question is, and I understand what you're saying, but people didn't even apply for the position. Why would they apply now? And I think, like, I'm worried that we won't get you the help that you need when we're moving this over.
I understand. I'm not aware that there haven't been any applications in the most recent recruitment. We did not find a qualified applicant for one of the positions, but we were able to fill one of the other two. So I don't know where that's coming from in the present time.
Okay, thank you.
Can you remind me what your other questions?
My other questions are that your office is it's very busy and you have a lot going on. And some of the concerns are that with added payroll, that it could, slow up things just a little bit more. I think that people want to be assured that adding payroll is not going to have negative impacts on other parts of your office. I don't know how to say that correctly, but that's what I'm hearing from a ton of people.
Sure. I can understand that when, there's a fear of the unknown, and when people don't understand our functions or what our departments do on a day-to-day basis, they can start to imagine and scare themselves into further anxiety. But what I am confident about is that Director Lee, Scott Johnson, and his team at MGO, and the Auditor Controller team, we've done our due diligence to ensure that the recommendation we are presenting to this board is the best option that we can sustain. The reality is that there have been several instances now where payroll almost didn't happen had it not been for Auditor Controller staff stepping in to assist. And so what we're trying to do now is make it so that Auditor Controller staff are able to proactively process payroll and reduce the amount of times that we are in emergency mode, in crisis response, where someone didn't get paid. And then we have to drop all of our operations to assist in paying that person. There's a lot of, actually almost every week, we encounter a situation where we have to drop our processes, our operations to assist. This is not because anyone is doing anything bad in human resources. It's not because something isn't being done correctly. It's a matter of, is there expertise? Are there enough people in human resources who can process payroll on the front end? And it's not necessarily just the Auditor Controller Department who's assisting, it's also County IT. We've been working together as a team for several months now to ensure that employees are paid timely. Payroll is a top priority for all three of our departments. We are just as invested as you are in getting paid. This is not something that we are doing without careful thought and consideration. We are working as a team, and when the time comes that we can invite other departments to view our operations or make decisions about how we run our departments, we will be more than happy to include them and get buy-in. But there also has to be a level of trust within our organization that you have hired the right people. We have the qualifications and the expertise, and you have we have the two departments that are processing payroll, and your independent consultant telling you this is what we need to do in order to ensure the success of payroll. So am I worried about this? No, I'm confident because I'm not alone. And I'm also not in the same situation that I was in last year. I have 12 people in the Auditor Controller Department right now, a lot of them cross-training in payroll. They are currently cross-training as we speak. They are in a Zoom room, training each other, learning how to do payroll, learning how to do tax deposits, learning how to do regulatory reporting. We are in a much better position now to assist in this endeavor.
Thank you.
Scott Johnson and MGO's help, we are already developing training materials for journal entries that we will be able to provide departments so that they understand how to submit journal entries. And hopefully it will help assist departments also get on track with submittals. So where we're not getting December journals in March or April. This is going to be a team effort, and it's going to improve county operations, not just for the departments, but also for the special districts and the partner agencies that my office serves.
Thank you for the answering my question. I really appreciate it.
Thank you.
So I'm going to go back to Scott, since I mentioned you earlier, and I had a different question too. When I got this presentation yesterday, because you guys briefed all of us separately, I believe, on what was coming. And I did mention to you that, how confident are you on this getting the backlog taken care of? And I think in some of the comments we heard from concerned folks in the staff or department heads, that was a really big piece of their thoughts. And I went, and now that you've heard how they're feeling about it, what are your thoughts on how would you get everything caught up? I mean, it feels like we're kind of insurmountably behind in some ways. And I know you feel very confident about it and with the team and the efforts and the collaboration, which is great. But I do want to ask you, because you have been through, and you've been in government, related to government in this type of field for a very long time. So it's not like you haven't seen challenges before.
Thank you, Director Bass. Yeah, you're right. I have more years of experience than I want to acknowledge. To put it in perspective, my wife and I this past week just celebrated our 40th anniversary. And I was finishing up college to learn to be and working as an intern at a local CPA firm. So I have a lot of, most of my career is in the government sector. I've been a partner in this firm, leading our advisory group for the last 7 years for state and local governments, have many various clients. But I was the director of finance for the city of San Jose for over 10 years. I was auditor controller treasurer for Santa Clara County. And I also had all the administrative functions reporting to me when I was assistant city administrator in Oakland. So do I feel confident? Yes, I do. And the reason why is, as your auditor controller pointed out, you know, things are getting caught up in her office. And there are certain reasons, as we're learning, as we're working together on why some of the backlog that has occurred. So there needs to be the templates that are being developed. So I've actually assembled a team of 8 staff that are assisting the auditor controller's office on areas of catching up on journal entries. And part of the auditor controller staff are also participated in some training on that. So we have a broad team to get caught up on journal entries. So I feel good about that. We're also in the process of doing your bank reconciliations. You know, those haven't been done for quite some time prior to your current auditor controller's office. And so we're working on that. We have a team working on that as we speak. In addition, we are working on fund reconciliations. And you may recall this was discussed at the audit committee meeting, and it was necessary to have those fund reconciliations completed by the time your external audit was done. And I think your Karen Paz-Dominguez, your auditor controller, can also share with you that she recently provided the working trial balance to your external auditor. So they have started the external audit. So that is currently underway. In addition, for 1920. And so the audit committee, at the audit committee meeting, your external auditor pointed out that they plan to complete the 1920 audit by the end of September. So we're working in tandem with your auditor controller and your external auditor on working on those fund reconciliations, bank reconciliations, and getting caught up on the journal entries. So we're making really good headway there. And finally, I do want to point out that there have been several new hires in the auditor controller's office to help on that backlog. They are getting caught up. So we're definitely seeing progress being made in the office. So that's why I feel confident in our team continues to support the auditor controller's office and their operations to help on that backlog and getting caught up.
Thank you. And I would think, well, in many ways, you know, not staking your reputation, but I know it is important for you, and you believe it can be done. And you know, it's the rest of us are going, we don't know how, but it sounds like you have a plan, and that's just I did want to get that out. But I had one other question, not for Scott right now, but I guess to Director Lee and perhaps Auditor Paz-Dominguez regarding the concept of an appointed working group, because I heard concerns, and then I thought I heard the auditor mention that after things get worked out, then people will be added. And I'm just thinking we've heard enough today that I would really like to see what we can do to bring something together. So to kind of bring people into the fold, or at least to some degree. So I don't know which one of you wants to answer that, or Scott. So
Chair Bass, can I just make some comments on that? first I want to say again that just reiterate how much we appreciate the collaboration, the input from the other departments. That is so important when you're dealing with central core operations. At the same time, I want to really congratulate your auditor controller because Director Lee reached out to her and she made the commitment to ensure that payroll continued to be processed. They worked together on that plan that Director Lee and your auditor controller went over with you in the presentation. That is huge. And from my professional perspective, that's huge. The county was at risk of not processing payroll. And your auditor controller and your Director Lee stepped up. They worked on a plan to ensure that that happened. So I wanted to comment on the letter because, as I mentioned, I have been involved in large organizations, large finance system implementations, multiple HR payroll implementations. Most of what's pointed out in that letter, which rightfully so, it relates to efficiencies and those in automation. And a lot of what's in the letter is what your auditor controller pointed out on next steps. When you have that steering committee and probably a working group working together, similar to what was done through your ADP implementation. So it's called a needs analysis. A lot of what was discussed in the letter is a needs analysis, looking at how you're currently doing business and how you can improve operations, become more efficient and effective. And there's another process called a fit gap analysis. You're looking at the software and you're seeing how the functionality within that software will fit your operational needs and where there may be gaps and how you deal with those gaps. So to me, that's that next step that Karen was talking about. But your core primary payroll functions has to be coordinated with either the auditor controller's office and HR. So those are core. We're talking about the background of your payroll processing. We're not talking about all the other touch points and your timekeeping and everything else. What we're recommending here, there's really no change to your payroll processing, but what is changed is you have more cross-training, you have the depth of knowledge and subject matter expertise. So I just wanted to bring that up and share my perspective because I really appreciate the input from your departments, but I think most of that is part of that next steps process.
Okay, and I guess that's what I was wondering is where does that fit in the next step? So maybe I know the auditor controller had her hand up at one time. So I'm just thinking for us to know how this looks in the future if there is an ability to have an advisory or appointed group, whatever you want to call it.
Yes. Thank you, Chair Bass. I very much appreciate the question because we don't have to imagine it. I can point to what we've done in the past for your consideration. In 2020, when we were going to upgrade our financial software from one solution to Finance Enterprise, my department stepped in to assist County IT in getting buy-in and direct participation from all county departments. I invited all departments to designate and delegate 2 different people from their departments to participate as testers and as part of a larger group that would see the Finance Enterprise before the rest of the county did, test its different functions, and provide feedback about the user experience. This group was in place for, I think, 3 months prior to the implementation of Finance Enterprise. That implementation occurred timely. We were able to go live on August 3rd as scheduled. My department prepared training materials. We hosted trainings, multiple trainings, and we also instituted our virtual Zoom office to allow all departments to log in if they experience any issues with the Finance Enterprise software. We were able to troubleshoot with them in real time and get their feedback about what the experience was like post-implementation. When I talk about next steps, there's a time and place where everyone gets to come in, and that's not now. The analogy that I use to best describe it is Director Lee and I have a house. We live in 2 different houses. Right now, we built a bridge between our 2 houses, and we're trying to clean it up. We have to clean our house before we can have guests over. We have to understand where we keep the utensils, where we keep the chairs, where the tables are stored. We have to understand our own operations before we can invite other people to tell us how to do it. There's only one auditor controller in this whole county. There's only one director of human resources for this county in this county. We need this time to be able to solidify our operations together. And it has always been our intention to include everybody else when the time and place calls for it. Other instances where my office has brought people together is in 2018, 2019, before the pandemic. We developed the cost plan working group, where we invited representatives from all of the central service departments and internal service fund departments to participate in putting the cost plan together. We hosted a joint training with the state controller's office, where we invited everybody to hear from both of our agencies and provide their input and their feedback. Later, Scott Johnson and his team at MGO were able to then jump in and assist with the further development of the cost plan and work more closely with those departments. There has always been an intention to bring everybody together. My department also has the county fiscal team email distribution group, where we are very transparent about the information that we send out and who it's going to. We don't limit it to just department heads or just specific fiscal staff. We ensure that information goes out to everyone that potentially deals with the finances. So I want to be inclusive. I want to bring everybody together. That has always been the plan. At this step, though, we are still trying to just solidify our own operations to allow for more people to come in.
Okay, thank you. I do see a couple other hands up. I should probably take my time. I think Supervisor Bohn and then Supervisor Wilson.
Yeah, Scott, you're talking about you've had a team of 8 working on getting the journals, and you cited numerous examples of dedication of your staff, and at the same time you're recommending critical employee function needs to be added. And I'm trying to figure all this out. You've been working for us for, it seems like forever, but because we're 2.5 years into this, and now we're getting caught up. And I'm wondering, and you were here, I don't know for what reasons, a couple years ago. And now we got 8 members getting everything caught up, and we've lost money at Public Works and at DHHS. And I mean, people, they're going to try to paint this as being political. And I can tell you, 7 years with the previous auditor controller, I think we probably only talked 5 or 6 times, and I went through all my emails. I think I had 3 emails from him. So it's kind of funny, but why are we getting resolved so late, or why is it coming in? I mean, it sounds like in the last 5 weeks, we've fixed everything. And I mean, payroll's fixed, all these fixed, but we are having quite a bit of, we've lost basically all of the old payroll staff, and for whatever reason, and other people. And I'm just, why is it taking so long? I appreciate the work that's been done. Karen or Ms. Dominguez, auditor controller, great job. Everybody, great job for doing it now. But why is it taking so long? And why is it now that, hey, everything's okay, even though we still have, we've had a lot of issues, and there's a lot of finger pointing on who all the issues for, but there's been a lot of issues. And why is everything being fixed now? I mean, the last 5 weeks we're at Disneyland now. It sounds like everything's fixed, but.
Supervisor?
Yes, sir.
I think that was a question for me.
Kinda.
Yeah, so I came over to the county the December right before the pandemic hit. And so one of the first things that your former interim county council asked me to look at was payroll, because after it was moved over. And one of the first things I did that very first day, I met with your auditor controller, and then I went over to HR and I interviewed the payroll staff. And so there were no written procedures, no written policies, and that was all acknowledged by staff. So there was clearly work to be done. There was an audit that was conducted by PERS that needed to be responded to that we assisted on. So in addition, then the pandemic hit. People were working limited. Some staff had left. But there are a host of different tasks that we were assigned at NGO to work on, including assisting on the reconciliations of claims for DHHS and coordinating with your auditor controller to get those, caught up. And so I'm not saying everything's done, everything is fine. I'm saying that I'm seeing from an independent perspective, a lot of progress is being made. And I'm seeing where now staff is being hired. You had a number of vacancies. And so there's this ability to get caught up. Also with my team from NGO, we're assisting in that effort. There's still work to be done. In regards to the movement, the recommendation for the movement, it's because of the risk that the county has been in and the issue of the separation of duty, the lack of internal control, the lack of subject matter expertise in a county, not having that breadth. But the model that was laid out, that was developed over these last 5 months, it's the right model. And I wholeheartedly believe professionally that that model should continue.
So I mean, just clarification, because we hear this, that we're understaffed, we don't give the payroll, and they were always asking for it because they used to have 14 people, 15 people over there, and now they've got no payroll, and we have 12, I think you said, and you and 8 others from your team working on it too?
Not working on payroll. We're not working on payroll.
No, but you're working in the auditor's controller's office. I mean, right now we have 20 people, plus you guys working in the auditor controller's office to get us caught up so we don't get any more tax liens which was a mistake by the federal government, but we can be on top of those mistakes everybody else makes. Is that about right? Is that what you're saying?
Supervisor, so there are 8 people that are working on, not full time, but I've got 2 to 3 people working on bank reconciliations. There's a backlog there. We're working on fund reconciliations too. We have about 4 people working part-time on it. And then we have folks that are assisting on the journal entries along with their auditor controller team.
And just for my notes here, if payroll goes back, how many people will you have working on them, working with payroll then?
We don't anticipate having any MGO staff working on payroll.
Okay. Will there be increased staff at the AC's office?
Related to the recommendation that you have before you as far as the staffing plan.
All right. Thank you.
Okay.
Supervisor Wilson?
Thank you, Chair Bass. Well, I mean, I don't think this. I think this started with Director Lee saying that there is not a perfect system in this, because these are anywhere, and I've worked in multiple companies, various sizes, and some larger than the county, and many smaller. And I can tell you, there's always change and adaptation, and there's always issues and problems, and especially when you have multiple departments, because not everything fits everybody all the time. So, and I see the options in front of us as each one of them is a bumpy road. Not one of them is, rainbows and unicorns at the end. It's still going to be hard work to keep these systems running. I don't see a lot of disagreement that the goal of what we see as option 1 is where we want to be. in sort of the long term. And I think that is important to recognize in this discussion today. So, and what I'm hearing, and I want to really, of course, there's a lot of accolades about the efforts that had happened in the last, month and a half or so of just holding together with duct tape and baling wire the payroll system and getting it kind of back into some function when things really went haywire, and I appreciate that. And then I also really appreciate the expressions from the staff that came forward with relationship to their concerns and their anxieties about the issues that they've been dealing with in terms of like basically keeping up with, or vice versa, the auditor's controller's office able to keep up with these systems and the backlog it's really been terrible, and people are having a really hard time with that, and there's no denying that. The question though is the recommendation before us going to have an impact on that, positive or negative? From my perspective, it seems like there's issues. Some are external to our conversation today that we can talk about at other times, and some is but the question is like, are we going to see domino or negative impacts to the recommendation that we see before us today? That's what's coming from staff. I don't see that as much. I think the concern is legitimate, but the concern would also be like, what are the impacts of not moving forward with what we're asking for today? It also has systemic and pretty significant issues associated with that can also impact all of those same systems. And at the core, if we don't have a sustainable or payroll system, it's even more core than the other stuff, like in terms of like just operationally. So it's like the nervous system, right? It's like we really have to make sure that that's functioning. So, but with that, I think we could be asking for, if we're going to choose to move with option one, I think there's some things we might be asking for in that process. And one would be a work plan of some kind of plan of how that transition really is gonna happen. And I want to ask, and this will be a first question as we kind of move forward. I want to ask Director Lee about the September 9th date in terms of that transfer. And is that do you think that's realistic? Do you think the resources will be available? In terms of staffing and those sorts of things, what's so significant about the September 9th date as opposed to October 9th or November 9th? And can you address that? Because I guess I wasn't totally clear on that date.
Through the chair, thank you, Vice Chair. The selected date of September the 5th as an effective date.
Sorry.
No worries. Was in coordinations with the Auditor Controller Paz Dominguez, in alignment with the quarterly report that the office would have to file with the EDD and the IRS. With respect to staffing, what does that work plan will look like? I currently have one payroll specialist who will be resigning August the 30th. So that leaves another vacancy. I have a payroll specialist who's been on a long-term leave. I am now having an extra help staff. I've been pulling staff from my personnel side, my HR technician to assist in payroll. So in the last 5 weeks, what we are doing is working directly with the auditor controllers, using the current staffing that she has in place through her senior fiscal assistants and her supervising auditor controller to manage the back end side of payroll. When we finish the role and send it over to the auditor controllers, those key staff have been participating in overshadowing the front end of what we are currently doing in terms of pulling down the data and doing the trial runs and the pre-list. So that cross-training is available. So if you were to adopt recommendation option 3, as you can see, I would be mirroring the type of job classification that is currently in place with the auditor controllers by requesting a supervising auditor controller and a senior fiscal assistant to help my payroll team on this front end side. So what does that transition physically look like? It means basically no current staff. We have a payroll technician, a payroll extra help who's currently working and developing training. I've also pulled my administrative services officer to participate in the training so that we can move forward and in development, this kind of proactive planning. The September 5th is basically moving the allocated positions so that the auditor controllers can move forward with the selections. And we would have to do the recruitments, get all of that, folks, but she has the deep bench of those 2 critical staff, the supervising auditor controllers and a senior fiscal assistant, to help facilitate the front end as well as the back end of payroll completion. When you ask for this work plan and transitions, in one of these slides presentations, the auditor controllers talked about the next step. The next step here is that for the 3 departments, the ACO, my office, payroll, and the county IT would have to collaborate to develop an actual MOU, clearly define roles and responsibilities. And this again is to address the back end, it's the function. We're not changing the software, we're not changing anything, it's just the function. So who's gonna be doing what on what date and what time so that we can push through the entire payroll cycle. Outside of that, we would have to develop responsibilities. HR would have to come in, facilitate the recruitment efforts for the positions in both the ACO and also in IT. That is where it would be the next step. Long-term, what the auditor controllers mentioned is again, bringing in a steering committee to look at the ERP software solutions. But that's kind of the immediate next steps in terms of addressing this transition plan. I hope that answers your question.
It does a bit. I think I'm feeling a little more comfortable with that. But the other thing that I think is that staff had brought up and directors is, there's some communication issues for sure. Again, it's a little external. I mean, it's tangential, but still part. It has connectivity with this question. And there's 2. For me, there's kind of 2 elements of that. There's the communications with relationship to auditor controller issues related to auditing and the journals and all that stuff. And we created the audit committee. And from my perspective, it seems like that might be a pretty decent venue for staff to have a voice in that space. And we may want to adjust our audit committee a bit to figure out a way to include those voices in some functional way that doesn't create a lot of time and into that. But I think we could probably do a subcommittee or something, some way to include that voice in there. But separately, with relationship to the payroll, it seems to me that as updates occur with the software, for instance, with Finance Enterprise or the ERP, it seems like that would be a very sort of line staff or middle management staff grouping would have some. There would be a way to have that interaction and have that have people come together, because that's going to be whatever we do today. There's going to be, and that was expressed in the communication. There's going to be needs for updating and there always has been, and there will be updating the software. And so I'm hoping that we can create a venue for that communication to occur. And so do you think we could commit to something like that, some way of doing that, so that, again, not today, because that's something, but I'm just wondering in terms of like the arc of moving this forward. That's a question for, I guess, Director Lee and the Auditor Controller.
Through the chair, thank you, Vice Chair, for that questions. I will respond from my professional experience in terms of managing ERPs and how we go about developing the steering committee. And yes, when we're talking about an ERP system, that is a software solution, and that crosses the integrations of core functions across the entire organizations. So you do want subject matter experts at the table. But through that, you also develop a steering committee or champion of sponsors who will own that project. And to get there, you also have to develop some kind of a project charter so that you have an understanding the roles and responsibility, the expectations, and then to manage the project. And that has to do with operational discussions, conveying the stakeholders in terms of their business need, how that will cross into this software solution. And definitely, I believe in one of the slides that the Auditor Controller mentioned is that if and when, if there is a recognition for that greater of the ERP expansions of finance enterprise, my professional recommendation is that you would need to include, at a minimum, your stakeholders would be the CAO and the IT, county IT, the Auditor Controllers, and some other subject matter expert to understand what is that integration solution will look like. And then from that steering committee, you also have functional work group that can look into what is the accounting will look like across the board, what is finance will look like, and where am I, if I wanted to be part of that integration solution, where is the human resources information system will tap into that ERP solution. But we're not there today. But that is a recommendation. That should be the focal point, the objective of looking forward, how to expand and leverage the ERP system that we currently have in whatever stage it is through finance enterprise. But I do imagine all of those collective key stakeholders will be at the table. And I would also like to add that because this is a huge project endeavor, it would have to be required coming to your board to inform your board what is the selections, what the steering committee. I mean, all of those are options for your board to consider. But I'd like to turn this over to Ms. Paz Dominguez if she wanted to add to your questions. Thank
and
you.
also, I just wanted to say, excuse me a moment, that our county council has his hand up. And usually I get nervous when he puts his hand up. Are you okay to go after the auditor? Where'd you go? There you are.
That's fine, Chair. It's just a procedural point. I can discuss it after the auditor makes her comments.
Okay, thank you. Thank you, auditor.
Thank you. I think Director Lee said everything perfectly. I don't have anything to add.
Okay, thank you. Yes, Jefferson. County Council Billingsley.
Chair, I just wanted to say, it seems like staff has been a part of this discussion. So when the board moves to public comment, I'd recommend that any other staff that want to participate be allowed to participate and separate out the staff from general members of the public that would be under the 3-minute time limit.
Okay, right now there's just one that I know of, but I will ask that. I'd like to bring up something before we go to public comment that I recall there is an option of the pilot project. It sounds like what's been happening is like a mini pilot project. Is there any value in maybe coming up with some, I don't know, a hybrid pilot that it has like some performance, like I think Supervisor Wilson mentioned performance measures, or you mentioned work plan. And I was thinking like performance metrics, so that there's a comfort level along the way that the backlog is being taken care of, that stuff is moving forward. I think that may be a way to increase the comfort level of some of the folks who have had concerns that spoke to us today from the staff perspective, I think. I'm just curious. I saw there was, I believe it's in our agenda that it's an option to look at, and at some point in time, maybe after public comment, we can come back and see if that's something people are interested in waiting in on. But I think we will. I'm going to go to public comment just so we can get those folks so they can leave their arms, put their hands down when they get done. If you're wanting to comment on this item, raise your hand by pressing *9. If you happen to be staff, I know one on there, staff, I'll go to you first, but because some staff have been on here to speak, you won't, if I'm according Jefferson, am I correct? Staff will not be held to the 3 minute. I mean, they don't have to talk longer than 3 minutes, but I'm not going to turn them off because others had the opportunity. Is that kind of what you're saying, County Council Billingsley?
Yes, Chair. Any staff that want to comment, regardless of their opinion, should be given the same opportunity.
All right, thank you. All right, so if you happen to be a staff member, definitely let us know. And again, if you haven't raised your hand yet, do so by pressing *9. And our first is, I believe, a member of the county team, and that's 4800. Press *6 to unmute. Welcome.
Hello, Virginia. This is Scott Adair. How are you?
Great. Hungry, but good.
I wasn't sure if I was going to be able to make a comment today as a staff member or as a resident during public comment. So I've actually prepared a statement that only takes 3 minutes for me to read through. So if you would give me the privilege of reading through this statement, I'll go ahead and do so now. Hello, board and members of the public. My name is Scott Adair. I'm a resident of Humboldt County, and I am employed by the County of Humboldt as its Director of Economic Development. First, as an employee and also as a manager of this organization, I call to your board's attention our organization's recent efforts to improve culture and inclusion throughout our county's various workplaces. Therefore, I applaud the courage of and support those staff who signed off on a letter recently directed to your board on this item. Whereas management may craft and authorize certain fiscal policies, it is the frontline staff who implement them. That said, I urge your board to consider the diversity of opinions which have been shared by alternative fiscal subject matter experts who exist in our own organization, and ask that you be inclusive of those other alternative perspectives of passionate county staff who desire to be party to developing solutions to operational challenges for the county as those challenges arise. Second, as a voice for and an advocate of the business and nonprofit community, I rigorously defend any item which could have lasting consequences on employers and employees throughout Humboldt. The work to advance your board's strategic economic framework, which was adopted in November of 2018, is intrinsically connected to collaboration between the Economic Development Division and the Auditor Controller's Office. Our two agencies have a good working relationship. However, recently, our two agencies strained to move more than $3.1 million in emergency COVID relief funds to the business and nonprofit community, an effort which took more than 6 months to complete. More relief funds are on the way, and seamless operation between our two agencies will be essential to our efforts to assist our community as we navigate our way through economic recovery. This is why any action taken by your board on this item today should be measured, should consider the capacity of the agencies involved, and should not be implemented with undue planning, with non-planning or undue haste. Third and finally, as the lead agency who manages the county's WIOA workforce development efforts, I call to your board's attention the nationwide and universal labor crisis, which is also affecting our own organization and employers and businesses and nonprofits in our community. Department heads today have expressed that their teams are understaffed and overworked. Other departments are using temporary staff to backfill full-time positions and are operating with significant staffing shortages. Shifting critical roles from one understaffed agency to another is not a long-term viable solution. Retaining and attracting a quality workforce for our organization so that we may effectively run programs to aid the taxpayer is. I beseech your board to consider long-term staffing solutions when considering shifting duties and responsibilities between agencies, especially considering that a continuance of decreased staff in our organization but increased workload only exacerbates complications which exist for programmatic delivery. In conclusion, I endorse and welcome the enhanced recommendations that have been brought by alternative subject matter experts. I also endorse any motion by your board which results in a calculated transition, creates clarity, enhanced reporting, transparency, and which is inclusive of others and the individuals in our organization. I support and implore for better retention and recruitment efforts to enable agencies to be properly staffed to administer programs designed to benefit our residents. And I really can't stress enough that our challenge and difficulty in recruiting, attracting, and retaining personnel in this organization is exacerbating challenges like the issue that's being discussed today. Thank you for allowing me to comment. I also have to plug that programs and information to help county employers and employees is available at the county's economic development website, which is gohumco.com.
All right. Thank you, Scott. And we have one other hand up. If you're wanting to talk and you have not raised your hand yet, press *9. But we will go to 4427. Press *6 to unmute. And start off by letting us know if you're a county staff member. Welcome.
Good afternoon. My name is Kara Fales. I'm a previous staff member of the payroll division. And I just wanted to let you know, first off, is I don't have all the answers to the ongoing payroll issues, unfortunately. These problems have been going on for many, many years, over 4 years. However, I do think that you all are experiencing a bit of a honeymoon phase collaboration between the AC's office and the HR. And I would just ask that you uphold your decision that you made in September 2018 and keep payroll out of the AC's office. However, on the flip side of that, it sounds like it could be a good idea in the future. I mean, it lived there for decades, right? Anyway, I just don't think it's going to work out with current staffing and the current auditor controller. Thank you so much.
Great, thank you. We have no other commenters on the line, so we will go back to board. So I did want maybe Director Lee or someone could respond to the concept of something that's in between full implementation by September and more of the pilot project to gain comfort from the team. I don't know who wants to talk about.
Thank you, Madam Chair. To answer your question, the last 5 weeks in terms of integration was just to expedite the process, was to open it up and anticipating workload so that we can partner and anticipate any rejections in the system and be proactive to problem solve instead of trying to problem solve after the fact. I would be remiss if I did not implement that collaboration 16 months ago when I came on board. There is a value added to have that collaborations and a communication, whether the system is between the two departments. I think the upfront communication would facilitate and assist in the product, the final product. To look at the hybrid between the integrations or the 6 months, that would mean we will continue with the model as is today. I would be down with staff. We would be relying on recruiting another round of staff. I would be relying on the other two controllers to ensure that the back end is moving forward timely Tuesday night so that we can meet Wednesday morning instead of Wednesday night and Thursday and delay all of those transactions that the other two controllers would now have to take on their side to complete the taxing payroll reconciliations. The collaboration will continue either way, whether it's an option 1 or option 2 or an option 3, because I still do onboarding, I still do recruitment, and those transactions, I see the importance of providing the projections of number of transactions upfront to payroll staff on the payroll side to process. But it is the will of your board, and I will honor, accept, and respect, and we will make it how we can to move forward. But knowing that we now have a recognition for me to build that internal controls, I will make every effort to build that firewall to demonstrate that we are committed to that course corrections and in trying to find progress at the same time. I would also like to step back in October of 2020, when the issue came up regarding delay payments, delay processings, invoices. At that time, I also offered to your board the opportunity for what I call interim measures. Those interim measures support is through MGO, boots on the leg, and I appreciate that MGO has afforded team members to really deploy and assist the auditor controllers, key critical front-facing and interactions with a lot of our financial subject matter experts in the county. But we're also in the process of conducting the staffing study, and I remain hopeful that staffing study will come back to also afford and to demonstrate the key critical components as to some of the functions and how we can best realign those operations effort. I would also like to add to your board too, that there's also opportunities. My work is not done. Your board charged me to conduct additional staffing studies in terms of operational realignment for decentralizations and centralizations. So the efforts of all of that, to me, is a movement towards something positivity for the entire organizations. And I will, those are my comments to your chair, and we will find ways. It has been very difficult at times when we don't have subject matter experts. And based on the comments from our public speakers, it is also something that I'm also mindful too, is that culture that I am also trying to embrace and embody and try to have this open communication line with respect. And that is what I will continue to do every single day. Thank you.
Thank you. And Supervisor Wilson. I must called you Director Wilson.
Commissioner or whatever.
Yeah.
So, all right. So I guess from my perspective, I mean, I don't want to personally want to lean too hard into option 2 because I feel like once we're heading down this path, we really just need to, we have an agreement, I think, universally that where we need to be is option 1 from a kind of like institutional perspective. And I know that and the concerns and the issues really have to do with concerns with the Auditor Controller's Office to have capacity, and a lot of that has to do with past issues we've litigated over and over again. And also, I mean, in current context, I think there's several references to communication and those sorts of things. And I know that there's some concerns from folks that are thinking, hey, there's been great communication for this effort related to what we're just talking about in the last 5 weeks, but there needs to be some concentration in similar communication efforts and collaboration with departments on some other issues. And so for me, I'm hoping that that's been heard today, and that how we move forward today separately, that those things will continue to be addressed. And I know that there's been some action on this. I also know that we as a board, if you remember, when we did the contract with MGO, right, there was a lot of side eye about that and concerns related to the relationships associated with that, and sort of who had I guess, there's some control issues, quite frankly. And a lot of that has been there's been just a lot of outreach and a lot of working together to get to that place. And again, I'm hoping that that extends beyond what we do today. I'm wondering if maybe if we could just, at the very least, as a kind of like an upgrade, get monthly reporting back in that gives us like basically a monthly update of the progress of this and any sort of bumps in the road or those sort of things. And for me specifically, I would want reporting that really speaks to the staffing issue of not impacting the progress that's being made in the auditor controller's office. Because I think that's just, again, that's just the concern. I think it's not unreasonable. It's a stressed space. They have there's issues with not enough folks there and all kinds of things. And so we want to make sure that we're not doing that. So from my perspective, a monthly reporting would be very helpful to do that. And so that's kind of where I'm at. And so Linda, can you give me any indication as to whether or not whether that's a reasonable expectation to have that come back to us?
I'm so sorry, Madam Chair. My mouse just froze and my video turned off, so I apologize. Whether the options 1 or 2 or 3, payroll is tied to the hip with whether it's HR or the auditor controllers. So if we put that aside, my commitment, this is my professional commitment, is that I will continue to provide a status report in terms of the recruitments, where we're at, the placements, the progress being made in the staffing studies that will all benefit the studies of the auditor controller's office. All of those are value added that will come back to your board, but I am committed to provide you the status report along with any metrics that you are requiring, whether it's in option 1 or option 3.
I appreciate that. I'm ready to make a motion to move forward, but I see Michelle has her hand up, so I'm gonna just have have courtesy on that. Okay. So I'm willing to make a motion.
Wait, hold on a second. I was muted. I was trying to go to Supervisor Bushnell and Bohn. Sorry.
Okay, sorry about that. Then I'll back.
I was trying.
It's all right.
So Michelle first, and then Rex. Sorry. I'll just keep my mute.
Thank you through the chair. I have 2 things I would like to ask. First, we haven't heard anything from the CAO's office, and so I would like to know if acting CAO would like to add anything. Alicia?
Oh, sure. Thank you, Supervisor Bushnell. I wanted to start by praising the staff who have come forward today with their opinions and their insights. They are really the subject matter experts in a lot of this. They're doing the work, and it took a lot of courage on their part, and I know they probably had a lot of stress over this. So I just want to acknowledge that. And, for me as a leader of the organization, I want to make sure that our staff feel heard and represented. So I'm really grateful for them doing that. I've lost a little bit of sleep over this decision coming to your board, because there is no perfect option. The human resources is struggling to keep up. They've had an immense amount of workload placed on them to respond to COVID and to navigate all of the changing regulations that are placed on their office. And likewise, the auditor controller, it has some challenges in keeping up with their workload as well. Staffing challenges have played into that. COVID has played into that. Sort of as we are all experiencing across the organization. I think from an operational standpoint, it makes a lot of sense for it to be in the auditor controller's office. That's where it was previously. That's where it tends to be across other similar organizations. But I do have some trepidation in moving it based off of our current environment. And I think that we would be remiss if we didn't place consideration on that. I lean towards option 1 or option 2 as the most viable options. I think either way, those options should include some reporting out, maybe even more regularly than monthly, like bi-weekly, so that we can monitor real measurable data, such as, where we're at with processing journals, where we're at with processing claims, when the last interest has been apportioned, where the cost plan is at in the processing, where we're at with all of the regular quarterly and annual standard reporting requirements, so that we can monitor that data and track it. And if we start to see challenges, we can quickly respond to that and mitigate, whether that's allocating resources, whether that's shifting gears and moving into a new path forward. I think that the pilot program offers a happy medium. It allows us to move towards the goals of human resources and the auditor controller, while allowing us a little bit more time to engage staff and to build a contingency plan should this transfer not be successful. That being said, should the board choose to move payroll over to the auditor controller's office today, I, like Director Lee, am here to support your board and to implement your policies. And I think that all of the staff that you have here today will do everything within their power to make that transition as successful as possible. So not a clear-cut answer there. I think we're all probably feeling the same way. If I had to pick one option on the cuff right now, I would advocate for the pilot program and to continue monitoring and continue to engage our staff who need to have a voice in this process.
Thank you. My other question is with option 2. So option 2 would be include moving staff to the AC's office, which would make, I guess, Linda, can you clarify, Dr. Lee?
Yes, no. The staff report is written that we do a full-blown transitions, but it will be a 6-month pilot demonstration. And the reason, the rationale behind that is that now the staff is now within the auditor controller's office. There is that team training, that cross-training, that synergies, that coordinations, and that flow needs to build. Otherwise, option 2 would just be basically, we will carry on what we have been doing in the last 5 weeks of this pilot process. Basically, my staff will continue to be in my side, the auditor controllers, and then we meet on a weekly basis and try to process payrolls and supplemental payrolls.
Which basically makes option 2 option 1. I mean,
yes.
Okay. Thank you for that clarification.
I'm a little more confused, but Supervisor Bohn and then Wilson.
Well, I'm just having a hard time looking at, I'm having a hard time looking at Lisa. I think you guys all got a copy of Lisa Dugan's letter, and probably one of the most respected department heads we've ever had in the county. And it speaks volumes, and I'm not going to read it, but I have a hard time when we've been talking about the payroll the last 5 weeks. It sounds like audit and HR, but I think isn't DHHS helping and sheriffs and everything? Aren't they in there helping? Linda? Nobody wants to answer.
Supervisor Bohn, at this time, no. Okay. Because again.
But they did help, right?
They did help. And
Okay.
That's why I made the acknowledgement. And the reason why I could not move forward with that continuing is knowing what is the proper controls.
I didn't ask that. I didn't
Right.
ask that. I'm just having, we have 11 financial people that handle all the financials for almost 80% of our county's budget. And we talked about, I've heard somebody say we're turning a corner, and I figured we're running into the building or something like that, because we're thanking these people for writing this letter and bringing all this forward and working with everything else, but we're going to go our own way. And there were requests made that I don't know if we're following up on. We can't do it today, I heard. I mean, and it has nothing to do with anything. Just, I want to make sure our staff, our vendors, the IRS, everybody gets paid on a timely basis. And I feel a little better knowing Scott has 8 people working on it for us. And I guess we'll just get, I'd never heard that number before, Scott, and that just makes me, when we're understaffed, I want to throw those into our staffing numbers. So, all right, I'm just frustrated as everybody.
Supervisor Wilson?
Yeah, I mean, I understand those concerns, but I think they're, for me, they're separate a bit, and they're real, but we're piloting right now the status quo, and it's not working, right? I mean, we're in a pilot project that's non-functional. I'm not clear that if we make a decision to do 1 or 2, if it doesn't work either way, 1 of 2 doesn't, it doesn't work, we're gonna have to pick a new direction, because then it won't be back to what we are now. That is probably not going to occur. So for me, I think a biweekly reporting will be very helpful on this. I understand the request for biweekly reporting of the journal entries and all that other stuff, but the problem for me, again, I could see a desire to do that. I'm not clear, like, on that list, how we connect that data to whether or not the transfer of the duty of these services or these duties to the auditor controller's office is functional or not. So we do need better data on that, and I agree with that. And if that's what it takes to to move this forward, then I'm okay. I would want some. I just need a little bit more definition of what that would be. From my perspective, the reporting would be on the transfer and payroll, and not and if there are impacts, negative or positive impacts into the auditor controller's office. And I don't know what the metrics of that would be, and I would leave it up to staff to decide what those metrics are. So I'm still okay with option 1. I'm still ready to make a motion on that with some amendments to strengthen that. Then I'm happy to wait for that.
Thank you. Supervisor Bushnell?
Thank you. I want to maybe ask a question, and based on what Supervisor Wilson said. So I like the idea of the biweekly reporting from it coming back to us. And I think if we transfer today to the AC's office, you would have a baseline of how many outstanding journal entries there are, but, et cetera, et cetera, et cetera. And then you would have a comparison if, with that report, if those other activities besides payroll are stacking up, then it could give you a report. So you would need a baseline kind of report. I'm imagining, and I'm asking if that's how we would do it. But I do like the idea of the biweekly report. And I also, I like the idea of a working group. Hearing our staff, and I agree that writing that letter and stating how you feel it was, it took a lot of courage, and I want to recognize that. And I like the idea of having, a working group as described in the staff letter, and, to recognize that there's a lot of anxiety with with everything, and it's organizational wide. And so I really think that that's a good idea also. Thank you.
Thank you, Supervisor Wilson.
So working groups are great, and I think that's something that should be done. But again, I don't know what the scope of a working group necessarily would be. If it's payroll related, then from my perspective, again, the core of that is generally probably going to be the functionality of how all these things work together, kind of around the software systems and those sorts of things. If it's auditor controller related associated with other functions, then again, we have an audit committee that might function, that might be able to interface or integrate with department heads and their staff. I'm just trying to figure out what that would be, and it would take time. I mean, everyone's stressed for time, and then we'll create another group, which it's just what, meeting fatigue is definitely something we all have. We're having it today for sure. So I guess my question would go to Director Lee and to the Auditor Controller. Can you imagine I get what you're saying. I heard the narrative about, or the analogy, hey, we're getting our, houses cleaned up and we're getting, and then we'll invite everybody in. But is there some sort of time frame where you would imagine that occurring so that people can feel like there's some movement in terms of, and then it can be brought back to us, because we're not going to create a committee today. We don't have the framework for that. That's not something that we can but we can set a direction that one would be created. And I'm hoping that we can get a little response to that.
Through the chair, Vice Chair, thank you for your question. I think I understand your question. Speaking only to payroll processing, regardless of what software solutions we have. Currently, we do not have a working group, but we process payrolls every other week and supplemental payrolls. It's a business process that we do on a regular basis. So we would be interfacing with the auditor controllers, trying to get the numbers of checks out. So in terms of metrics, I can say that what are the numbers of errors, what are the number of rejections that I currently have, what is that baseline? I mean, those are the things. And we also have lists of things that have not been touched upon. So I would be depending on what metrics you're looking for. But to answer your questions regarding the committee, we currently do not have a committee regarding payroll processing on a weekly basis. And I welcome staff's recommendations of how we can have that discussions, what that look like. But what I operationally believe that makes most sense would be in the software solutions. If once we stabilize the payroll function itself, and we have the staffing capacities throughout the entire organizations, and we have no backlogs in finance, what have you, that we've heard today, that is the right time for us to develop what is the ERP solutions will look like for the county. It will be a multi-year strategy, and I think that would fit under some kind of a strategic framework with your board direction so that we can work toward. And that is where the most beneficials of having a steering committee to address that. I also appreciate the ideas of returning to the audit committee to voice concerns, issues, so that from there we can develop a mini work group, if that is the case, to address pockets of other non-payroll related issues. But the topic for our discussion today is, what is the core functions of payroll and what does that look like? I hope that answered your question. But I'll leave this over to the auditor controllers to share that perspective. Thank you.
And after that, I'd like to say what I'm thinking I heard the employees say what they'd like to be hearing about. And it's not necessarily payroll specific. So we can go, if the auditor controller wants to say something now, or I can tell you what I think this committee is kind of what may be what people are looking for, and where it fits, I don't know. But I think it's about concerns. Yeah, obviously we need payroll done. People definitely that want that done, but at what expense to other things? And currently, and Scott is working on the backlog, and I want to believe wholeheartedly that is going to work out well. But the staff haven't had, I think many departments have had concerns and challenges with it. And the system, just the one simple thing that could really change things is to change the method of emails and messages, and the messages we get back saying, we'll get back to you, and we get back to you, and then you don't hear people. So, that maybe that doesn't belong in this committee, but there are some conversations that need to be had regarding those things, because there may not be exactly payroll, but they're definitely part of the bigger picture. So that is what when I think of committee, and I'm not staff or anything, but I'm hearing a lot of people that have been concerned that they're afraid that they're going to go further by the wayside. And I want to respect that, because I think it's a real concern. Actually, Auditor Paz Dominguez, I think you were speaking next, and then I'll go to Supervisor Bushnell, then Wilson.
Thank you, Chair Bass. I'm going to remain focused on the issue at hand, which is the placement of payroll. We recommended option 1 because it's what we can sustain. We want payroll to be successful, and we are hopeful that your board is staying focused on that, because that is what we can sustain. That is what we need support in. There are other department heads here in this meeting that haven't spoken, and maybe you can invite them to speak as well, so that it's not just the same 2 voices every time. I understand that everyone wants to have a say in how we operate our departments, but in this situation, the 2 departments that process payroll are Human Resources and Auditor Controller. Once we have solidified that process, we're going to report back to the audit committee, as we demonstrated in our presentation, after we've had a successful quarter of payroll activity, which is in early 2022, we're going to come to the audit committee. It is at that point that everyone will have an opportunity to offer feedback about how we've implemented this change, what their experience has been, and any potential ideas they have for how to improve upon the operations of payroll. I don't have capacity to keep sending bi-weekly reports, but I'm happy to contribute if Director Lee wants to do that. Your weekly report will be your paycheck, as far as I can see. Or if you give us a clear metric of what it is you want to know about payroll and the payroll positions, I can answer those questions. But I think at this point, we're going around a lot of different topics that are not necessarily related to the issue at hand. And that is, how can we successfully and sustainably process payroll every week? So I'm committed to that. And I'm committed to doing the best I can to sustain payroll, which is why I endorse option 1.
I agree, except not at the expense of something else. That's my concern. Supervisor Bushnell and then Wilson.
Well, I wanted to make a motion, but I'm interested in the reporting to make sure that just with all the concerns, that everything kind of stays status quo with that moving over there. But you just said you don't have the capacity to even do reports, but we're going to add payroll back, to you. So it just makes me concerned, but I wanted to make, I guess I'll just make the motion and see what happens. So I want to approve, I want to make a staff recommendation for 1, with the condition that the auditor controller shall provide bi-weekly reports to the Board of Supervisors on the performance of the overall department.
Okay. There's a motion. Is there a second? I'll actually second it. I actually liked it, so I'm allowed to second.
Always.
Just try not. So now we will have discussion. Supervisor Wilson.
Sure, I'd like to speak to the motion if I may. I'd like to modify, if I can, if I can get the motion maker to modify the biweekly reporting. I think the biweekly reporting should come from the HR and not necessarily the auditor controller's office, in that because this is an HR issue, it's driven by HR to make this change. And so from my perspective, I think that the biweekly reporting can come from HR. I think that we're not going to know what those metrics are. I think some have been discussed today. And I think that HR and the auditor controller can work together to draft these reports with feedback loop, right? I mean, there's gonna be some responses to those and those sorts of things, and so we're gonna have to just adjust to that. And I appreciate that. I would also include in there, and I guess maybe Director Lee can speak to this, some kind of work plan or outline that we receive. Do you think a week is too soon to receive? I mean, I saw what was in what you gave us in the presentation. Do you think there's anything that would be more detailed that we could see in terms of work plan or time frame, or do you think that work plan that you presented today is detailed enough?
Through the chair, vice chair, the operational work plan would detail roles and responsibilities, timeline of how we get there, the various stakeholders, in this case would be the auditor controller's office, HR, payroll, and the CAO IT division. We would be remiss to request Mr. Johnson to facilitate that discussions along in partnership with the CAO's office. That way, we are looking at a comprehensive coordinated efforts in terms of business process improvement. So between the CAOs and Mr. Johnson's, I welcome that opportunity to clearly facilitate that discussion so that we can come back. I cannot put a timeline into it. It depends on how quickly we can convene a meeting to have these ongoing conversations, but that is going to be something that we would have to detail out to do this transition, because not only you're moving allocations, you're moving functions, you're moving, business rights, and all of that is all tied into the budget unit. So there's quite a lot of steps that we would have to iron out. But yes, a work plan can be returned to your board. I would recommend that we incorporate that work plan as part of my biweekly report to you. So that way you can see the commitment that we're moving forward and where we are with the progress.
Mm-hmm. And this is, I guess, a question for Scott. Where do you feel like is a reasonable, timeline without being too pushy in terms of getting the work plan?
Realistically, I would think that would take, several weeks to put it together.
Okay.
And understanding it would be a draft and a work in progress.
Mm-hmm. Okay. So if I ask, I'll try and summarize my request for an amendment with relationship to the motion, which is that the biweekly reporting come from the Human Resources Department, and that we also ask for a work plan to be integrated into that as well, and based on our discussion.
And before I hear back from Supervisor Bushnell, I see County Council Billingsley has his hand up.
Yes, Chair, if I may, I had a suggestion for the wording of the amended motion. I'd like to offer, I think, just to make it a little more clear.
Is it amended or modified?
Modified, depending if it's accepted. But I think what the board is looking for is biweekly reports of the impacts on departmental operations on both the AC and HR on the realignment of payroll functions. I think that gets to the core of what you're looking for and maybe gives a little more direction. And that could come from the HR department, but it would be some sort of joint report of the effect on both departments.
And before I get an answer from the motion maker, CEO Hayes has her hand up.
Thank you. I just wanted to throw out there as a suggestion, because it appears that we're moving towards the recommendation of option one. Cheryl Dillingham, who I think the majority of us are familiar with, has been retained by my office as extra help to serve as the assistant CAO / chief financial officer. And so we would be more than happy to share her with the auditor controller and to help with developing this transition plan and participating in that process if the auditor controller were agreeable to that assistance.
Thank you. Guess I'll ask the auditor controller.
I would like to hear from Dillingham because her name has been tossed around by a lot of people, and I would like to hear from her what she would like to do, what she is willing to do. I don't like volunteering people.
I can speak to that. I'm not sure if she appears to be on, but she told me she had to leave. But I don't volunteer people. I spoke with her this morning and asked if she would be willing to serve the county in this capacity. But Cheryl, if you were on through the chair.
Cheryl, are you still on? Your face is on, but are you there?
Yeah, I think she had a.
Okay.
But she's texting me. She's double booked at the moment, so she is in another meeting. But I can confirm I did have a conversation with her, and she was agreeable to assisting.
That'd be great.
So we had Supervisor Bushnell made a motion. I seconded that. Supervisor Wilson suggested different language, and then County Council Billingsley offered what it would sound like. So Supervisor Bushnell, back to you.
Oh, wait, hold on. I just wanted to confirm that Jefferson's language was, I think, a reasonable adaptation of what I'm suggesting for modification.
Okay, thank you. Supervisor Bushnell.
So my motion, the reason I made my motion is through the discussion today, most of the conversation has, or a lot of the conversation has wound around moving payroll to the AC's office and what it would do to Ms. Paz Dominguez workload wise and how it would affect the rest of her job. And that's been a conversation that I've heard throughout the entire day. And so my request or my motion would, what I would like to have happen, and I don't know that what your modification does, is to get that report from the AC's office that it's not impacting her other workloads, because that's the concerns I've heard today. And I don't know how Director Lee would know that in the report. And I do understand Jefferson's language, and if that, I guess, could be a joint report, but I want, just from the concerns I've heard today, I think it's necessary that we make sure that moving payroll to the AC's office isn't impacting the rest of the office negatively. And I don't know how we get there if we don't request that report.
But you're believing that with the language offered by County Council Billingsley, that could suffice for the getting to the same information?
No, I don't actually believe that.
Okay, so I thought you were talking about
AC's office.
Okay, I thought you said joint. So
and I would be willing to modify my motion to include the help of Cheryl Dillingham additionally, if that is agreeable with her. So I guess no, Mike, it doesn't work for me, for my motion.
seems like we should be able to find something that's pretty similar in here.
Yeah, I'm just going to ask that Jefferson read his amendment, or his, not an amendment, but modification one more time, and maybe combine the two departments together in there instead of just one, and see if that does it. Can you reframe that with both departments, Jefferson, and see if that helps clarify things?
I can through the chair. It would be option one with biweekly reports, with a biweekly joint report from Human Resources and the Auditor Controller on the impacts of departmental operations on both departments resulting from realignment of the payroll functions. And secondly, that the work plan for the realignment would be folded into the biweekly reports when it's ready.
So would the, thank you, Mike, can I ask something? So would the report, the biweekly report come from both, then both, if in case we had questions, would come from both people being involved in the biweekly report, or would it just be a consent biweekly report?
Through the chair, I just recommended a joint report. I think the level of detail, if you want an actual report, that would be up to your board, or if you want a written report.
Okay.
And it can be pulled at any time if it is on consent for conversation.
I understand that. I just was asking the question. Thank you, Chair Bass.
So does that make you more comfortable with his language in your motion? I'm just trying to figure out what we have as an actual standing motion.
Thank you for that. Can I ask about the addition of Cheryl Dillingham? Does that need to be part of the motion, Jefferson?
Through the chair, I think that kind of direction would, the CAO could do that without your board direction. That's just which staff would be involved in the project.
Okay, all right, thank you. Could we hear from Supervisor Madrone in case he has?
Yeah, I was gonna get, and I see the audit, AC has her hand up again too. So Supervisor Madrone.
Well, I strongly support the motion as amended. I really think we're doing a good thing here. You know, a year ago, there was a lot of conflict between everybody, but that's just not happening here. You know, the primary parties here are all working really well together. And I think this is a very exciting move forward. Yes, we have a lot of stuff to tend to, no doubt about it. We're going to need all hands on deck, department heads, and all those other members of the departments that have been helping through this transition. And I very much appreciate their offer to continue to step forward, the deputy directors from the various departments, et cetera, financial people in those departments, to help make sure this transition goes well where they're asked to provide that help. And I have no doubt that the circle will be broad and wide as far as communicating and working together. So I think this motion's great. It's exciting to me to see how well everybody's working together. And kudos to you, CAO Hayes, for reaching out to Cheryl Dillingham. I don't think we could have ended up with a better situation than having her and you both on board with us. I'm very excited for that. So good move there, and welcome aboard, Cheryl.
All right, so before I go to the auditor, we have a motion. I'm the seconder is fine with the restated motion. Right, did Jefferson, did you restate that motion finally? Yes, you did.
Yeah.
Okay, so I'm still fine with it. Supervisor Wilson had his hand up, or if you'd cede over to Auditor Controller, then I can come back to you, Supervisor Wilson.
That's fine, yeah. Mm-hmm.
Okay. All right, Ms. Dominguez.
Thank you, Chair Bass. A couple things. One, I want to remind you that we want to avoid duplication of effort. And your board formed an audit committee where I would specifically be asked to prepare such reports as those that are being requested now. I'm committed to continuing those reports. I would like for your motion to be successful, which is why I will advocate for a motion that I can sustain and something that I can actually do and perform and be successful at. As I shared before, I'm more than happy to contribute to Director Lee's report. And I my opinion is that Supervisor Wilson's modification is an appropriate one that I could accommodate, and might also suggest that it be done on a monthly basis rather than bi-weekly, because as you know, we need time to be able to do this successfully. And payroll is a weekly event on top of my office's other tasks. We've focused a lot on journals, but I also have the property tax function, and I also have schools districts and special districts. And so I think a reasonable time frame would be a monthly report where I can give you a comprehensive detailing about all the operations in my office. Bi-weekly seems like it's pushing it for everything that I already have to complete and my team has to complete. So in short, I would really appreciate consideration of the modified motion, and I'm more than happy to work with Director Lee and Scott Johnson of MGO and with Cheryl Dillingham. I have a great relationship with them and I can be supportive of them.
Thank you. So Supervisor Wilson, I know you had suggested a modification, and I'm not sure if that's which one that Auditor Controller is talking about, but I thought your modification was folded into what Jefferson suggested. So it's part of the original. So now we're down to the conversation then, I think, on the time frame. But Supervisor Wilson, you had your hand up.
Yeah, I think we're getting there. I would say that and I'm comfortable with monthly. If it requires bi-weekly for us to get over the hump here, then I'll go with that too. And my response to the Auditor Controller is do what you can. You know, I mean, in terms of like what's exhaustive or what's needed or what you can do, and you know, in that framework of what is reporting, if monthly is more detailed than the biweekly in terms of what the responses are, I think this is all going to be an iterative process, as I known to say. It's like it's just going to be a feedback loop. So I'm not too worried about that, and some of these metrics can only be measured monthly. They can't be measured bi-weekly, right? It's just not even possible. So some of our metrics are only measured annually, right? So I think a do what you can is a reasonable approach. So I'm okay with maintaining the where we're at, and hopefully that people can work within those parameters to the best of their abilities. With listen, everything we're doing right now, whether it's this or anything that we're doing at the county, we're doing with a level of humility and a level of understanding that we're stressed and strained at every level, from line staff to managers to citizens that are interfacing to just, we're all going to have to be understanding. So I'm hoping that our evaluation of these reports are with that in mind as well. So I'm hoping that's a two-way street. So thanks.
Thank you, Supervisor Bohn.
Yeah, I was going to mention monthly would be fine. I mean, if we get them, but and I don't know if our paycheck is really considered a biweekly report. I think I'll take a little bit to that. I don't think I could take that as bi-weekly report because I know I put my time in. Yeah, I can't support it. I just don't think we're supporting our line people. We talk about it. The people that came today, the people that spoke, the same old two that speak all the time, but I'm not hearing anybody else step up because I've heard from a few of them and they're worried about stepping up. And again, if everybody would have read Lisa Dugan's letter, they would have understood. So I think there's more to it. I'm sure Scott can put a couple more people on and do our monthly report for us, but that's going to come to an end someday, I hope too, because that's a duplication of process because we have people paid to do that job and he's having to backfill. I mean, we have to look at those options too. We always hear about spending this money, but it sounds like we needed this money just to to stay almost afloat. So that will be my reasoning. I'm going to support staff.
Supervisor Wilson?
You're muted.
I appreciate that. And I appreciate, again, staff and the directors in there. I don't see this as not supporting them because I don't really see that then what's being suggested is not something that will come to fruition. I just want to be really clear, like we have to, so, I mean, we may see that a little differently, but I do believe that ultimately we're all trying to support staff. And again, like so many things, the endpoints are we agree on, the strategies we may disagree on. And so and going back to my original statement, none of these directions are easy or fun, and they're going to be fraught with some issues all the way around. So I'm ready to vote on this. And I do want to appreciate everyone's hard work. And I'm going to redouble my efforts in terms of hoping that we can, get these systems better and better. So thanks.
And the extra bonus was getting Cheryl on board without knowing it. So, it's good. All right. Supervisor Bushnell.
Can I just ask one thing? I just want to recognize that payroll is multitudes of every department, and you guys get time kept and sent to you from every department. And so while I understand that Linda and Karen say, it's a lot for their department, I just want to recognize that payroll involves every single department in our organization. And it is multitudes of work for every single department to get that information to you. Without that information from those people in those departments, you wouldn't be able to complete your job either. So I do want, I do want to recognize that it already is multitudes of people, so it's not singly done. And I also am very supportive of our staff, but want to recognize that we need to do something that we can try to get to work. And I am so supportive of staff, even if my emotion is what it is.
Thank you. And actually, I'm going to say it's a second, or I'm going to say, I think your staff does encompass it. I think we talked a lot about how important we want to hear how it may be negatively impacting. And I want Scott to hear this too, because a lot is riding on the efforts that we all put into this. Supervisor Wilson?
Well, I don't want to amend the motion. I do want to express an expectation that something will be brought back to this board, which includes some systemic or some programmatic way that we can get a better feedback loop with staff related to payroll. And so I'm just putting it out there that's an expectation, and that doesn't have to happen up today. And I think there's a lot of work to be done, but I just want to put out that I have an expectation. I think other board members do as well, that we will see something like that in the future, and not the distant future, especially after some things stabilize here. And so I just want to say that's been expressed by us, and I'm hoping that we'll see that sooner rather than later. Thanks.
All right, Tracy, I think we're ready to vote.
Can she restate the motion, please?
Certainly. Tracy? Your lips are moving, but I don't hear you. Yeah, it says it doesn't say you're muted, but we can't hear you.
Go into your
volume.
Go into your microphone and their preferences.
It just changed in the middle of the. Well, perhaps we can go back to Jefferson stating. Oh, she can't even do the vote though.
She can come down to my office if she wants.
Jefferson can do the vote.
All right. Everybody got in motion over there.
Okay. So the motion was option number 1 with the joint bi-weekly report from the HR department and the auditor controllers department detailing impacts on departmental operations on both departments resulting from realignment of the payroll function, and with a work plan for the payroll realignment integration into the report when it's ready. Is that correct, Supervisor Bushnell?
Yes.
Okay. So the roll call vote, please, would be Supervisor Madrone,
Yes.
Supervisor Wilson,
Yes.
Supervisor Bohn,
No.
Supervisor Bushnell,
Yes.
and Supervisor Bass.
Yes.
Passes 4-1.
All right, well, thank you all for your attention to this, and thanks, Scott, for visiting us today. And we have had a long day already. We got to eat something. We have a time set at 3, and we have the D9 still to discuss. And I mean, we have 2 closed sessions, right? I'm looking at somebody who knows.
Correct, Chair Bass. You have 2 closed sessions.
Okay, so I suspect most people would like to eat something. So, I mean, I can eat in 20 minutes. I don't know about the rest of you. Tracy, we still can't read your lips.
Through the chair, what do we have? We have the D9, and do we have any other items that are on the agenda that are open session besides the time set?
I think D9 is. I think we're good in. I think D9. Tracy is wanting a 5-minute break to fix this, but I think we might get a few minutes longer than this. I mean, because we have D9 and then 2 closed session. One's at time set at 3 o'clock.
Oh, okay. And so I would imagine D9 is probably half an hour or maybe more, right? So even if we come back at say like 2:10 or something like that, I think we'll be fine.
Yeah. All right. Let's come back at 2:10 and see if we can hear Tracy again.
Okay.
Spokesperson. I think we should get the report first. So. All right, so we're going all the way back to D9, and we have enough of us here, so we're going to go ahead and start. Welcome, Robert. So D9 comes to us from Health and Human Services. It's a professional services agreement regarding supportive services, outreach, case management, with individuals and families who are experiencing unsheltered homelessness. So Connie or Robert.
Yeah, so thank you, Chair Bass and members of the board. I'm Connie Beck, Health and Human Services Director. Here with me today is Robert Ward. He's the housing coordinator for DHHS in the county. And I think we also have a caller here that should be the contractor to answer any questions that you all may have around this contract.
Okay. Just trying to figure out. All right, well, we'll go as we go and we'll ascertain if that is the correct person. So Robert, do you want to give us the background first?
Sure. So we have about $5.5 million in emergency solutions grants, coronavirus funds. This was part of the CARES Act. And we sent out a letter asking for any providers that were interested in operating projects that would be funded under this. And so far we've received applications from Cooperation Humboldt and one other organization for street outreach services. So we evaluated the applications to see if they met minimum threshold requirements for the funding. You know, it's the 2 requests totaled a little over 10% of the funding that we have available. So we decided to go ahead and recommend any projects that were meeting those minimum requirements, since we need to spend all of this funding by July 30th, 2022. And it's just not looking great in terms of being able to spend down all of the funding. So we didn't want to, you know, split hairs around which applications were most, you know, going to be most effective.
Robert, I just am curious why we've only gotten 2, or do we expect to be able to gather more along the way? Because I mean, it's a big, we have a lot of people that need serving, you know, I mean, that's pretty obvious. But
no.
Okay, so
well, I have not been just listening to the meeting all day. Don't worry, I've also been working at the same time. So I was talking to Darlene Spohr with Arcata House Partnership is working on an application as we speak. We also received a letter of intent from the city of Eureka, and as far as I know, they're still planning to apply. So those 2 providers would be the big ones in terms of the amount of money that they were looking at applying for.
Okay.
And then through the chair, we also have a contract that's being worked on currently with SHOW, the Southern Humboldt opportunity.
Okay. Yeah, we saw that. Okay, cool. Okay, so Robert, we'll probably have some questions for you first, and then we'll see where we go. But I do see Supervisor Bushnell has her hand up.
Thank you, Michelle Spine. And I just want to say that, you know, being new, I sometimes have more questions than the other supervisors that automatically know the answers. So I thank you for indulging me. I wanted to ask, when you said you sent out letters, my understanding that this is an RFP that was sent out. Does it get published in the paper? How do we get the message out there?
So there was a request for proposals in the fall, and the applications we received were not really on point with funding requirements. We did a lot of work with county council, and we came up with a different process for selecting the providers here. There's this concept in federal regulations around subrecipients versus contractors. And working with council, we decided it was more appropriate to classify these folks as subrecipients, which that brings with it different procurement requirements, and allowed us to go ahead and send out the message to the Humboldt Housing and Homeless Coalition email listserv, as well as the Housing Trust Fund and Homelessness Solutions Committee, that we were looking for subrecipients. Please send us your letters. So it's a bit different than the usual RFP process.
So in essence, it wasn't an RFP, which I kind of understood it was. Okay, thank you for that.
I think, do you have more, Michelle? Michelle, I was just saying, I think on top of yours, I'll ask a question when you're done on that piece.
Well, I have, I do have some questions about the, that I would like to ask the group receiving, just for clarifications. Do I do that through you, Robert, or how do I do those?
I believe they are on, we think if we have, yeah, I think zero, sorry, I do believe I'm trying to get there, Tracy, where's my number at? Disappeared my screen. 0333. If you are part of the group, just press *6 to unmute so that we can have a conversation or ask you questions or hear about it.
Hello, this is David Cobb, Executive Director of Cooperation Humboldt.
Hi, David. Nice to meet you over the phone. It's Michelle Bushnell speaking. I just had a couple questions, and I don't care where they get answered, either from Robert or from yourself. But when I was looking through the applications, I was wondering, you guys, to receive the funding and to do the outreach, it doesn't look like you guys have ever done this kind of work. And so I was wondering about the capability with staff and that, how do you intend to engage the population? And one of my other questions along with that same line is, do you intend to engage the population, the houseless population or outreach in the South County area, which would be my district?
Thank you, Supervisor Bushnell. So with permission, I'd like to back up one step and sort of share with you how it came to be that we were part of the Houseless Coalition and were aware of this and engaged. Because really, we sort of came online at Cooperation Humboldt during the COVID pandemic when it first hit. And two of the key people who are part of the anchors for us through this process are Oscar Mogollon and Sabrina Miller, both of whom were instrumental in creating what became known as the Humboldt County COVID Community Response Coalition, which were over 20 different local service agency and providers who were running errands, delivering supplies, literally making masks and hand sanitizers and distributing it. And all of that work had been focused on the most vulnerable in our community, houseless folks, immigrants, and through that process, we really developed the kind of support and relationships that led us. And then, when last year's fire season, we turned that all into a support, mostly led, I want to acknowledge, by the American Red Cross, but really, there was the Office of Emergency Services who, like governmental services, who on a dime know how to deal with fire evacuees. But through the American Red Cross, Pay It Forward Humboldt, and Cooperation Humboldt and the Salvation Army were really recognized to be the groups that were dealing with what is known as spontaneous donation and volunteers. And I want to lift up Pay It Forward Humboldt, which were really superstars on the material donations and distribution, but we really earned a reputation as being able to both generate and manage volunteers appropriately and knew how to stay in our lane, right? Like, we didn't go in just have shovel, we'll travel, but like we're asking, where do you need us, and supervising our volunteers. So it was out of COVID response and then the fire response and developing these level of relationships that led us to the what is currently before you. The three main anchors for Cooperation Humboldt are Tobin McKee, Sabrina Miller, and Oscar Mogollon. All three have been trained in human-centered design through the Humboldt Area Foundation, which includes specific training in the use of what's known as interview techniques to be able to meet different populations wherever they are, however they are, to ask what they need before services are delivered. With your permission, I'll also just say a word or two about each one of them individually. Tobin McKee is the executive director of the Middle Way Network, which is a nonprofit that provides free training for individuals and organizations regarding nutrition, exercise, leadership, and mentorship programs. Oscar Mogollon is a native Spanish speaker who has been the absolute linchpin to and for Comunidad Unida del Norte Arcata, or CUNA. He is an activity coordinator at the Adult Day Healthcare of Mad River. He's also been trained through Bungalow Support Health Services, administering medications, dealing with conservators. Lastly, Sabrina Miller is currently employed with the Redwood Community Action Agency's Youth Service Bureau and formerly had a position with the Raven Project. I think all of y'all know Raven Project, of course, dealing with houseless young people. And it's worth naming, and I did get Sabrina's permission to share this, Sabrina herself is a formerly houseless person. Lastly, Oscar and Sabrina serve on the Humboldt County Health Board's Substance Use Disorder and Dual Recovery Committee. So that's just a quick answer to the question about sort of who we are and why we think we're very well positioned working under Robert Ward and the DHHS to provide the services according to this contract.
Thank you so much for that. And I thank you for indulging me being a brand new supervisor. I often have more questions than some. So can you tell me where you intend to engage your services and whether you intend to engage it in my district?
Yes, and so Supervisor Bushnell, first of all, we are very eager to continue to expand into Southern Humboldt, and we are going to be working with DHHS, and we hope through the Southern Humboldt agency to cross-pollinate. Because one of the things that we're actually quite good at Cooperation Humboldt is to say, like, we're sincere, like we want to collaborate, and if there's already somebody else doing something, we actually lift that up and try to support it, and so with that in mind, it is our expectation that we would probably be mostly in a support role, specifically in Southern Humboldt, because we have learned through DHHS that there is likely to be another agency coming online or a recommendation under this to receive this federal money. Now, if it doesn't happen, I can tell you that we absolutely are committed to Southern Humboldt, and we have long-standing relationships with folks in Southern Humboldt that would be able to engage. But the reality is that it is our expectation that Arcata, Eureka, and McKinleyville would be the main places where we would be working. And on that note, I'll just sort of give you an example. On July 25th of this year, Oscar Mogollon, working through CUNA in partnership with the city of Arcata, engaged in an Adopt a Park partnership at Carlson Park in Valley West. Now, I've lived here since 2004. I'll admit, I didn't even know there was such a thing as Carlson Park over in Valley West. It's because it's basically a vacant lot, or it had been. And honestly, there's an entire houseless community in and around the Mad River, all back along that area. On July 25th, under Oscar's leadership, there was that Adopt a Park program that had several hundred people, including many houseless people, at a festival with music and food and children's games, dancing, etc. But in addition to that, they worked with, and Oscar worked with the county's mobile vaccination unit, and we got 16 vaccinations that day. And then really excited to say then on August 22, there was the follow-up street cleanup at that same site. And this, instead of just, food and dancing and so forth, was, okay, let's get to work. Y'all, 62 people showed up. We had AHA unit there. We had the vaccination unit there. And over half of the people doing cleanup there were houseless people from that community. And using that human-centered design process and with that houseless community in genuine partnership, they literally came out and participated. And the really exciting thing I want to share is 36 people got vaccinated on August 22, almost all houseless folks. The last thing that I'll say is, again, acknowledging it's almost all Arcata, Eureka, and beginning in McKinleyville. We have 25 what are known as little free pantries dotted all across the community. This is places, and the houseless community know very well where these are, and these are stewarded by individual residents. I myself have one in front of my home, but members of the community put food in and others take it out, where we're just sharing food with one another. We have 10 more of those coming online, and it's because of those relationships that we're able to leverage this. And we have, I think, genuine trust relationships with the houseless community, because we're not just service providers, right? We're genuinely community organizers.
Well, I'm really glad to hear that. And one of my other questions you answered was, it takes a certain amount of time to gain trust with the houseless community. And sometimes brand new entities working within that circle don't get any traction. And so it sounds like you already have that traction, which is really good. It'll make your efforts more effective. And the last thing that I wanted to ask you is, I was looking through your, of what your personal costs are going to be. And I see that the outreach workers and the amount of money, and then for the benefits also, but it doesn't say amount of staff that you will be increasing. And I'm just curious, actually, a lot of these items aren't really, it has a number, but not really a great description. So I was wondering, what do you anticipate your staff increase would be for the outreach program?
Oh, Supervisor Bushnell, I'm just grinning ear to ear that you've asked that, because one of the things that makes us unique, and I don't want to put Robert on the spot, but one of the things that we literally baked into that is that we've got several folks that we will be bringing on. I've already mentioned Tobin McKee, Sabrina Miller, Oscar Mogian, and then we've got some other folks that will bring on. But a big part of what we're doing is actually under training, under tutelage, we would literally be helping houseless people to become ombudspersons for other people. And that again comes from our training in the empathetic interviews, human-centered design approach, where we're really trying to, the only way to do this is to genuinely humanize houseless folks and engage them as members of our community. And based on your earlier conversation, Supervisor, I can tell that you, I think that you get my drift, right? Like that we're not just trying to be a typical service provider. We're trying to actually bring a little special sauce into the relationship.
Well, thank you so much. And I really appreciate you answering all my questions. And I'm sorry that you had to kind of be my guinea pig. All this is new for me. So I really appreciate it. And that does answer all my questions that I had. Thank you so much.
So it was my pleasure.
Would you get off mute?
Sorry, Supervisor Bohn. My computer is making noises, so I went on mute. Sorry, Supervisor Bohn.
Yeah, I was going back to Robert, what he said at the beginning. And so I take it when it's going, there were no letters sent out to anybody, because I called a few of the groups, because where I appreciate more people getting into the game, part of this contract is to get out and reach and get with the homeless people and understand who they are. And, I think of all the groups that are already here in place that are doing it. And then you said that we had $6 million we had to get rid of by 2022. So we were willing to take someone that wasn't most effective, I think was almost and I know we love to spend that money, but the whole idea is to spend it most effectively. So.
Well, through the chair, we sent out an email, so it was not a physical letter, but it was to the HHHC listserv, which includes all of the homeless service providers in the county. As far as, if people are doing things that are kind of, not under a regular contract or something like that I don't know about, then I hope those people will sign up for my email list so they can get these sorts of notifications. But there are, a lot of providers on that list. I think all of the nonprofits that do this type of work. And then, the comment about effectiveness was just that the application process was not designed to try and rank the projects, because the letters of intent that we received indicated that we were going to have enough money for all of the providers to do the things that they were proposing. So it just wasn't, it's sort of an over-the-counter funding process rather than a competitive process, given the amount of money and the tight timeline to spend it.
Okay, and then
through the chair, can I add clarification to what Robert was saying? I think that it's important that we step back and say there was an RFP process to begin with that started. We got little participation. Historically, Arcata House Partnership has been the one of the only providers that has been able to use ESG funding. There are some pretty strict criteria and requirements around reporting that some of our partners are not interested in doing. Robert is also responsible for preparing and collaborating with partners around the point in time count. And so he's very well aware of the need in our community for these type of services. So when we say we had $5 million to spend, it's, wow, we have $5 million to spend, and gosh, what can we do in our community to help this situation, because it's so huge. So I hope that helps a little bit clarify. And I think that there's the homeless information, and I'm not going to think what it's called. HMIS is a homeless system that every provider is responsible for filling out contact information about homeless in the community. So there is checks and balances with these funds. They're pretty strict checks and balances too. So I just want to make sure that it's not a willy-nilly over-the-counter funding stream. It is yeah, it's work intensive. So I just wanted to say that. Sorry for.
Okay, Supervisor Bohn, did you still have some more?
Yeah, and then one last question of Mr. Cobb.
Okay, David, you there? Oops. David, are you still on? Oh, press *6 to unmute. Thank you. Okay, Rex has a question.
Yeah, that's good.
Okay. And Mr. Cobb, I know you've been putting in for a lot of different grants. I know you put in for Measure Z and some housing grants through the city and things like that. I think this will probably be the biggest grant you've ever got. Are you worried about, with all these grants, so many places you're spinning off, are you going to cut yourself a little too thin, or were you just are you just going to focus on this now? I've looked at your site and everything else, and I'm just wondering, you've thrown your hat in the ring in a lot of places. You're an expert on a lot of stuff.
Well, I don't know about that, but I can but I do appreciate the question, Supervisor Bohn. And what I would say is this: first, this isn't a grant; it's actually a fee for service. And as Department Head Beck pointed out, like it's pretty darn strict. Like we have to actually provide the service first, then go through a process to get paid. So this isn't actually what I would think of as a grant. It is true that we've actually put in a grant through the U.S. Department of Agricultural Rural Innovation Stronger Economy Program, which we're very excited about, and very pleased to say that we've got, along with the Wiyot tribe, have letters of support and memorandums of understanding with many of the folks in basically economic development to the city of Arcata, the city of Eureka, and REDAC. But that is actually a separate project. Part of the reason that Cooperation Humboldt has grown so quickly is because we do what is known as a sociocratic organizational process, where, if you'll notice, I'm not doing any of these, this particular project that's currently before you. We have a circle called the Care and Wellness Team that has actually come together to do that. And so that circle of folks are the ones responsible for it. The Dishkema Humboldt, which you may be referring to around housing, is actually under the leadership of the Wiyot tribe, and myself and Tamara McFarland are the two key people doing that. So we feel very confident telling you that the ability for us to do this particular contract, we've got the people lined up and ready to go.
All right, thank you. And I'm sorry I missed you in the fires last year. I know I helped Desiree for about 23 days in a row get rid of about $200,000 worth of donated items, and Supervisor Michelle Bushnell worked alongside me. We were talking earlier that we didn't remember seeing anybody from Cooperation Humboldt, but
Well, Supervisor, I appreciate that. And that's actually why I wanted to lift up so specifically Pay It Forward Humboldt for the donations and the material goods. What made us, and that's where I think at least how I associated the two of you mostly through that particular project. And it's again why the staying in our lane, because really what we were doing was the work mostly under the direction of the American Red Cross to help the evacuees actually at some of those other shelters and providing and distributing the hot meals, right? So that's what I meant about knowing how to really collaborate and stay in our lane and do the work that we were actually tasked to do through those fires.
Yeah, good, great, glad to hear.
Okay, Supervisor Bushnell.
Thank you. Through the chair, my last question is for Connie, just so I can understand the process a little bit better. So when, I see their line items, and when they bill you or bill your guys' DHHS for services rendered, does it come at an hourly rate, a set rate, a fixed rate? How does that work?
I'm gonna let Robert talk about this, but there's an invoice, and I think that a sample invoice is part of that contract.
But I saw that, but it doesn't say.
Oh, it's not itemized? Okay.
No, it's not itemized. That's why I'm asking.
Yeah. Robert, can you?
I just don't understand the process in general.
Sure. Okay.
Well, on the budget, we looked at how this is a subrecipient agreement, which is different than a contract in terms of the way the federal regulations work. So we looked at the way that the state usually does these ESG subrecipient agreements, and they will just have one line that says street outreach, $200,000. That's the whole budget. That's all the detail that you get. And talking with HCD staff, the idea there is to give the grantee flexibility in the budget so that if there are changes in terms of hourly wage or something, we don't have to do a contract amendment. And also so
Robert, her question is more around the invoicing and the process for the invoice.
So they will be sending invoices that show the number of hours worked, and we would be able to determine the hourly wage based on that.
Okay, thank you. And then once again, David, thank you for we can't get too much help in this arena, that's for sure.
I'm going to go Supervisor. Okay, we're going to go Supervisor Madrone and then Wilson.
Thank you, Madam Chair. First of all, I want to thank all of the providers in the county who step up to do this work. None of it's easy. It's very complicated. It takes huge commitment. And, the questions that Supervisor Bushnell was asking were very on point. And David, representing Cooperation Humboldt, also very on point. Building relationships with this community is huge in terms of truly providing services, right? If you're not really helping, then you can't just come in and force stuff on people. So I want to commend Cooperation Humboldt and all the other providers for stepping up and doing this. If I heard correct, Robert and Director Beck, you're hoping that with proposals you're working on with Arcata House Partnership and the city of Eureka, and perhaps finalizing the one with Southern Humboldt Opportunities, et cetera, outreach services, that with those and the existing proposals you have, we may very well be able to tap into this entire 5.5 million. Is that correct? Is that your hope?
That is my hope, certainly. However, time is running out to spend the funds, so we really need applicants to apply quickly.
Yeah, No, I get that. You know, it's always amazing how, I mean, for the 2.5 years I've been on the board, I'm still kind of new too, Michelle, and I really appreciate your questions. You know, Connie and I have met many times, and it's always a question of where's the funding coming from and where are the sites that people can be at for camps, tiny villages, whatever. Those have always been the two big issues. And suddenly here comes 5.5 million and you need to spend it like yesterday. I mean, it's like, what's up with that, right? I mean, especially if you're going to be building camps or doing long-term programs that are really substantial and make a difference that ultimately help lead people into housing, because you've got a safe place for them to be, that we can bring services to, their sanitation, et cetera. And to dump money on counties like this with a 9-month turnaround or whatever it is, I mean, that's just ridiculous. You know, what we really need is programs that say, here's 5 years worth of funding, so there's sustainable funding. Because when you go to set up all of these facilities and programs and the rest of it, we all know it's a nightmare if you don't have sustainable funding, because the setup is a huge part of all of this, right? And to spend all this money on setting up and moving forward and then have it go away in 9 months, that's just ridiculous. But that's not in your hands, and I know it frustrates you guys as much as it does us at the board. Couple of other comments. One, there was a new law passed last year that basically requires all counties and cities that have an emergency shelter declaration to put together a plan. And that plan was due July 1st. The county does not have a plan. We're behind on that. And I know the county is now aware of that. It came up at the Housing Trust Fund Homelessness Solutions Committee meeting. Robert and Mary were also from planning, helping to inform the group. And I know they're working with John Ford and others to help move that process forward. The city of Eureka actually did develop a plan. It was a couple of weeks late, but they got it done in July. And I just forwarded that over to John Ford. There's some excellent stuff in there about how to try and reduce the requirements for these temporary facilities for housing, providing shelter for people experiencing homelessness. It reduces the code requirements. There is still health and safety requirements, but there are various codes that are a little more relaxed around that can be adopted. And I won't go into all those micro details, but the city of Eureka has a great template. We at the county really need to get this in place. One of the barriers we have is that our emergency shelter declaration only allows us to use that on public property. It doesn't cover private property, right? And so the solutions in our community are going to involve both public property and private property. There are private property owners who are willing to set up sanctioned camps on their property. I would submit to you that Yeehaw up in Trinidad is in some ways one of those sort of intentional communities that's been trying to provide, actually not trying, they've been providing housing for people for 30 years. But right now, with the way things are set up, we couldn't really provide assistance to that. It's really rare for a private property owner to step up and say, I want to create a safe place for homeless people to live. And so I hope we can embrace those kinds of things. I hope we can get our plan done soon, and that will in fact reduce the code requirements and make sure that we're looking at private and public partnerships. And that will really open the door for a lot more opportunities for locations, right? So we're starting to see the money come down now in big chunks, and hopefully that continues. And so now location, where's that at? Where's the surplus property with Caltrans, the county, or the cities? Where are private properties that might be willing to do these things? So I'm really grateful to DHHS staff for working with these programs and getting it out to our communities, working with all the partners. And I'm very supportive of Cooperation Humboldt and all of these various providers that have been stepping up to help us with all this. So I'll leave it at that for now. Thank you.
Right. Thank you, Supervisor Madrone. Supervisor Wilson, your hand was up, but now it's gone. And now it's up.
Oh, sure. I mean, I just wanted to reference that I had received some questions from community members related to, mostly just related to capacity, which I think were expressed and I think were addressed. mostly just due to the newness of an organization that, at least by the records here, annual budget of, roughly half the contract amount. And so and not all the information that was expressed today was in the packet. And there's a lot of folks that are in these arenas that who were just wondering where that experience is, because they really, have experience on the ground. And so we're just, I guess, kind of doing a check, right, on what's going on there. But I just wanted to just say that I had received those things. I've heard what's been said today. I think there's a lot of capacity building that's occurring in this space. I'm totally cognizant of the criticisms that of the kind of the statewide sort of start and stop efforts that with regards to funding that Supervisor Madrone is mentioning here. So, and I'm totally cognizant too of the reporting requirements that this will have. And I think it by itself, just that administrative element will be, capacity building, I suppose, for an organization to have to live through and go through. Certainly not just the external services that are to be provided as well. So we're all in it together. We'll see how these things roll out, and hopefully that it is part of a capacity building response. So thanks.
Supervisor Bushnell.
Thank you. Can unmute myself. Through the chair, Robert, I just have one final question. When you said the invoicing would come in and it would be itemized, is there a set rate of hourly wage that is allotted? Who sets that hourly rate? And this is a general question that I have for all these things that are getting funded.
The contractors determine their hourly rate. So Cooperation Humboldt, shared their plan with me at some point. So I have an idea of what the hourly rate's going to be.
Okay, thank you.
All right, David, are you still there? You are, press star 6. Okay, so this is Virginia. I was gonna welcome, and glad to have you involved in this process. And it's no secret. I think you and I have had multiple different. We don't necessarily agree on certain things, but I am very thankful that you guys are stepping forward to move in this direction. I wanted to follow up from what Supervisor Wilson said on some of the other content in the emails that at least I was receiving. There's a concern from some that somehow these dollars would be used politically, and I don't think that would be anything that would be allowed through the process we have. But I just want to give you the opportunity to respond to that, because personally, I don't think that's what this is about. I think you guys are really trying to build capacity and help people. But I did receive heard from people with concerns about that as well.
Well, thank you, Supervisor Bass, for the question and the transparency. And the reality is that you and I do know each other, and we've been on opposite sides of things electorally, right? And, this is a democracy. There are going to be differences of opinions. And I've always appreciated that even if we disagreed, I always felt like you treated me with respect, and I hope you felt the same from me. I mean, it's like we can disagree vehemently, but we can do so civilly and respectfully. And I genuinely try to do that. But to answer your very specific question, as a lawyer, I am crystal clear that as a 501c3 organization, Cooperation Humboldt cannot engage in what's known as electioneering. That is activity to support or oppose any individual candidate. So we are very careful never ever to cross that line. But more specifically, this is a fee for service. And again, Robert has sort of clarified the specificity of it. But all of these services that are currently before you are very particular street outreach that actually have nothing to do with what we would think of as electoral politics. So, that's my effort to to address what I understand the question.
Yeah, well, and thank you. I just wanted you to be aware of, because Supervisor Wilson mentioned one of the concerns, and I appreciate that. I appreciate your answer. Now, and I don't know if David, if you know this answer, does anyone know if there's one hand up from a 7423, and I don't know if that's a public commenter or someone else from your group. So are you expecting anyone else to be from your group on this call in this meeting? David?
I was not, but again, there may be, so I don't recognize those 4 digits.
Okay. Well, and when I go to public comment, I'll check again. I just thought I'd ask. All right, so I don't see any board member hands up right now. So if you are listening in the public and you'd like to make a comment, press *9 to raise your hand. And currently we do have a couple hands up, and this will be the 3-minute time limit. And so 7423, you're first to go, and press *6 to unmute, and you have the 3 minutes.
Thank you, Chair Bass and Board. My name is Ryan Rice. I'm president of the Humboldt Prosperity Alliance. While realizing that there is an extensive issue with our homeless here in Humboldt County, we are concerned with this particular grant, its potential recipient, for numerous reasons, as the disadvantaged homeless community needs as much resources for the efforts that we could possibly give. We're concerned with Cooperation Humboldt and question the lack of demonstration of their qualifications to run the homeless program as proposed. Furthermore, the services described in the professional services agreement are vague and lack any performance standards to show that these funds will be used to provide important services to our homeless population. There are multiple entities with a long, successful history of providing services to individuals experiencing homeless here in Humboldt County that would be much better suited to efficiently work through this grant. We're also concerned about the time frame in which the money was supposed to be allocated. The staff report states that the service agreement was held up due to inadvertent delays, which happened during the contract development process. This is concerning to us due to the fact that it was delayed by 3 months, and we're wondering the reason for the delay. Success cannot be accomplished in the short amount of time that the allocated money has left with an organization like Cooperation Humboldt that has questionable qualifications or programs in this type of work. Our next point we would like to make is that there is a faith-based clause within the agreement that disallows an engaging in any inherent religious activities. When this agreement moves forward, the same type of clause should also be amended into the agreement banning any inherent political activities as well. Humboldt County has not just a displaced homeless problem in and around Eureka, but in other areas too, such as Fortuna area and Southern Humboldt. We think it appropriate to see a plan that has been vetted through on how outreach will occur evenly throughout our county. We'd also like to know the end game or the metrics looking forward to the end of the program and what goals we should expect to see accomplished. We believe that the homeless crisis is something to take very seriously here in Humboldt, and we also know the best approach is being responsible with the resources allocated in order to give the most benefit for the underprivileged people that we are serving. We would ask that you consider alternative measures to the staff recommendations due to these points. Thank you.
Great, thank you, Ryan. Our next speaker has the last 4 digits of 2070. So if you are 2070, press *6 to unmute, and you'll have 3 minutes.
Hello.
Hello, welcome.
Hi, this is Tina Christensen. I'm sure I know all of you. I am now president of Humboldt Citizens for Safety Incorporated. We're a new formed group of business associates that want to reach out after the Jeff Pauley incident. With Jeff receiving the stabbing that he got in the Arcata area, we decided to form a coalition to start seeing if we can raise community awareness with the business community and with the cooperation of all of the faith-based groups and the Arcata House, those people. We've met with a lot of them. We just got formed, and we had no idea that this money was available, or we would have put in an application for something. What I think that all of us just discovered it within the last week, and we feel that there wasn't enough transparency in the outreach part of it. I'm sorry, but I feel that that just doing something 2 years ago in outreach instead of making it an RFP out to all of the public and not just the homeless communities, homeless committees, because I've served on 7 homeless committees throughout the last 15 years, and through 2 directors, and also helped with Betty Chin and the creation of the shelters that went into place with Hum CPR and those. So I ask that you reopen this whole process and allow everybody an opportunity to come in and try for that, because I think the process was flawed. So I thank you for the time. And again, this is Tina Christensen with Humboldt Citizens for Safety Incorporated. Thank you.
All right, thank you, Tina. And we have one last hand up. If you're still interested in speaking and you have not raised your hand, please press *9. And if you are 1352, press *6 to unmute. And then you'll have 3 minutes.
Good afternoon. This is Lane Russ calling in. I wanted to speak to the awarding of this fee for service. I'd request that you guys take a harder look at this award and at a minimum require some additional metrics for both performance and accountability of the use of these funds. As someone who's sat on boards responsible for significant grant funds, this has to be one of the most undefined and open grants that I've seen. It has significant chance for misuse and malfeasance for the use of the public funds. And I think given the track record of this organization, it would be irresponsible at this point to turn over almost $500,000 worth of public funds. The current metrics need to be improved greatly. That includes a better defined task and a way to measure both the tasks that are completed as well as how successful they are at it. Also, a rate schedule for the use of funds and accountability for that time. As it stands, awarding almost $200,000 for outreach and making contact is way too broad and undefined with no reason or measured of accounting for those activities. At this point, it would not be, to me, in the county's interest to award this without significant revision or rescoping to potentially more qualified applicants. Thank you very much for your time.
All right, thank you, Ryan. Lane. Sorry. All right, so we have a couple more hands up. 8538, press *6 to unmute, and you'll have 3 minutes.
Hello, this is Oscar Moguillon with Cooperation Humboldt, part of the Street Outreach Program. I would like to say a couple comments, and I also want to validate everyone's concerns on this process. It has not been a smooth process for our team as well. I want to state that the work that we have been doing this far to carry this program, to get some feedback, a lot of the time that's gone into that, because this process has been pushed forward, over 3 months. That's been unpaid. We've been doing this unpaid out of just us wanting to get to know and understand the infrastructure. This has been a difficult process because a lot of the providers are busy actively serving, which is something we value and something Cooperation Humboldt wants to tap into in an appropriate way. So we've been working with AHA in communication with AHA. Lately, we've also gone down to Free Meal, talked to some of the staff down there. We've made connections with Hatcher, which serves, an additionally disenfranchised population of users. And so we are very much taking into consideration all the amazing, wonderful work that's going on. At the same time, I do need to say that all that work is neutralizing, and it is not getting the amount of help and services out there to the people who need it. We need change. We need a creative, strategic approach, and we need to do it together. And what we're doing is trying to find those partners, those collaborators, and those people doing that hard work that really is there for the community. I would agree that a lot of these funds should have been made more readily available to other groups so that they could autonomously work on their efforts. I know currently right now that AHA has trouble staffing their mobile shower clinic, as well as having an operating expense. And that's a super vital resource that the community needs. I want to touch base on Carlson Park. And I want to say that that park is scheduled at some point in the future for people to just get completely wiped out of there with no real steps to care about what people's futures or where they're going to go is going to be. I mean, it's illegal what's happening, right? Illegal camping. So our vision is to build the relationships with the people that want to be part of the solution. And from our events at Carlson Park, we've seen that people do want to be part of that solution. Another argument that I hear brought up a lot is that the amount that we're getting received is half of the budget of our organization. And I want to reframe this as saying that that's a good thing. You know, we have made community partnerships. We are spreading and we are growing on an exponential rate. And we want to make sure that everyone who's been doing this work is involved in that process. And that takes time. And it's going to be a process that we're all going to have to step into and embark on together. So I don't think that us having half the budget of what we're asking for is unfair. I think it's actually an indicator that we do have some momentum, that we are growing, that we're not overextending ourselves, but we're responding to the immediate and grand need that this community needs around individuals experiencing houselessness. Thank you all for your time.
Okay, thank you, Oscar. All right, and if you are 9929, press star 6 to unmute and you'll have your 3 minutes.
Hi, my name is Sabrina Miller. I'm another one of the leads on the Street Outreach Program. I want to thank everyone here today who's been taking the time to engage in this conversation. I especially want to thank Robert, who has been really working hard to move this process forward. I'm hearing some people expressing a desire to open this back up to the community, but I really want to express to everyone that we've been really working for the past, this entire year, to try to get this funding through so that we can get individuals the services and the resources that they need. And it's almost winter again, and I don't think that we have time to extend this process any further. As Oscar expressed, all of our time so far has been volunteered, and pretty much so. And we've been developing some really strong relationships with the individuals we've been working with, and they're really excited to be a part of this program. And I'm really looking forward to what this can become. We are very aware that our organization is newer in this work, but we have spent the past few years developing really strong relationships with a lot of organizations that have more experience in this field, and they've been nothing but supportive of us and our efforts and want to help us grow and develop, because they understand that there is such a strong need for this service that anyone who's willing to put in the time and effort to be a part of the solution is worth supporting. And so yeah, I'm really grateful for everyone that's supported this process so far. And I'm really hoping that we can move forward and really, really start to implement this program, because our community needs it and it's already benefiting greatly from it. And we are definitely open to feedback and people's input on how we can, do our services better and be in support of all the various needs of the community. It's part of the process of all of our program development. And so, yeah, just hoping that we can all come together to work through this. Thank you.
Thank you, Sabrina. We have another call in of 7300. And if that's you, press star 6 to unmute.
Hi, thank you for taking this comment. My name is Tobin McKee, and I'm also on staff at Cooperation Humboldt. Real quick, I just wanted to share that the foundations of this program are standard street outreach and emergency winter weather preparedness. in accordance with Housing First principles. And if you read through our standards and our policies and procedures, you'll see that those are based on best practices and have been thoroughly reviewed and supported by Robert at DHHS. And so just in terms of that, the questions about accountability and achievable outcomes, what we're really looking to do is standard street outreach practices, connecting folks who have no access to any alternative shelter or choosing to or unable to access any shelter to get just basic winter weather gear, and then connected with a process that takes them toward accessing all of the housing support services that are available in collaboration with everybody who's already doing this work out there. So that's it. That's the goal and the focus of the program. And just putting people on the ground to go out and make contact with those. And all of our community partners say, yes, we just need more people to make those relationships so that folks who are in the worst circumstances are given the support they need to access the resources they need to get out of those circumstances and into a better situation. So I just wanted to put that forward as far as, you know, what the goals of the program are and the standards for accountability. Thank you so much.
Great, thank you. We have no more hands up. I do want to go to Robert first, and then I'm going to go to Supervisor Bushnell. But I'm just, there's a few things I'd like you to try to clarify before, you know, for this conversation. I think one thing was said that HHHC is, it sounded like the vision is that it's a, you know, a small group of certain providers. I haven't been to HHHC for a long time, but it seems like it is a lot more expansive than that. So that's one of it. If you could like give a better outline of what that's in there. The other thing is, can people still apply since we have not given out all the money yet? What happens if people do have a project? Can they do that? Yeah, and you know, you explained earlier why we didn't have multiple entities, you know, filling these out. So, you know, there's a lot of people that exist, but you can't twist people's arms to fill out and promise to do something if they're not ready to do that. So anyway, Robert, can you answer most of those if it made sense? And then I'll go to Supervisor Bushnell.
Yes, I believe I can. So just to clarify again, we did actually publish a regular RFP through the regular county process that was published, you know, just like all of our other RFPs. And the responses that we got were not really aligned with the program requirements. We asked for the letters of intent to try to get an idea of how much money the providers were intending to apply for so that we could figure out whether or not we needed to design a competitive application process or a process where we were looking at threshold requirements and then trying to go ahead and get the projects started. So because the letters of intent came in right around the amount of money that we have available, adding in new projects right now, unless somebody wants to drop out, could be, we'd have to think about how to go about that. I mean, the city of Eureka in particular, if they would drop out, that could free up some money. But you know, there are other funding opportunities. Like for example, right now, the regular emergency solutions grants NOFA is out, and we are asking for letters of intent to apply for that due by the end of this month. So anybody, you know, I heard someone mention Betty Chin. Certainly Betty is on the email listserv. So is AHA. I feel like I know everybody that does homeless services in the county, and they know me, but maybe I don't. And if I don't, I want to know you. Please get in touch with me. Let's get you on the email listserv. So I would encourage people to look at the regular ESG NOFA that we're asking for letters of intent on right now. The question about, you know, what is the HHHC? I could give you, you know, numbers as far as how many different people get the emails, but it's a lot. I'm guessing 200 or so, representing just a lot of local governments, tribes, nonprofit providers, and just interested citizens.
such as churches, and I mean, it can be expansive. And if someone is interested in being on that list, they can reach out to be added to it.
Yes. So we do have, the county has a web page, and it has the email address where you can shoot us emails and get added to the list. Or feel free, I'm rward@co.humboldt.ca.us.
Thank you, Robert. Supervisor Bushnell, then Madrone.
I think my question was answered, but I just want to make sure. So what is the amount of the next amount of monies that can be applied for? Did you say that is due in a month, right?
Yes. So this is the regular emergency solutions grants. That was the big challenge with this money, is that the CARES Act injected $5 billion federally into this program that is normally a trickle. So we didn't have, someone mentioned Arcata House was one of the only, they're literally the only organization that's ever operated an ESG funded project in the county before. It's a rather complicated funding stream. But specifically to answer your question, we're looking at $200,000 would be the max per the state for the competitive street outreach or shelter. There's also a non-competitive portion. That amount is a little bit less, maybe 130.
So I'm sorry again for asking so many questions, but we have this huge amount of money out there that has to be spent down by such and such a date. And so, and the max that you could apply for right now is after this is 200,000.
Yep. Like I said, we could discuss with the city of Eureka whether or not they are still planning to apply, which could potentially free up some additional ESG CV funding.
Well, I see Director Beck had wanted to say something.
Yeah, through the chair, thank you. ESG is one funding stream, and then there's other funding streams that are going to be coming available. HHAP, there's a round 2 or a round 3, or there's several pots of homeless and housing funding that's coming available. I don't even think we know what the amounts are for some of them yet, because they're still kind of working out those details. I do have some ideas around the current 5.5 million, because I wonder if when the interest letters were submitted, if those budgets were taken into consideration from the time that the interest letter was submitted till the end, there may in fact be monies that aren't really accounted for. But I'd like to look at that with the team and see what that looks like.
Okay, you mean what not accounted for means there may be some more available.
There may be more available.
And Supervisor Bushnell, are you done with your questions at the moment?
Yeah, for right now. Thank you.
Thank you. So I have Supervisor Madrone, and then Supervisor Bohn. You had your hand up, so we'll do Madrone first.
Thank you, Chair Bass. Good discussion. A lot of good points being made here. Betty and her team, because it's not just Betty Chen. She's got an incredible team, right? We all know that. When she first started, she had no experience. I mean, this is so true of everybody. AHA had no experience. I mean, that's kind of the way this works. What's the most important component is compassion, hard work, and willingness to learn, adapt, and to bring programs to the community. And I think Betty Chen and her team of people, her foundation, are a great example of somebody who started very small with limited background and knowledge, but great compassion and commitment. And we can see how that's grown over time. It's grown into really quite an array of services for our community. So I applaud her and her team of people. I think this is also true of Cooperation Humboldt. It's certainly true of AHA and Arcata House. I mean, Arcata House has been around for 30 years. And when they first started with their first house, they didn't have a lot of experience either. So, the job here is so big. I really welcome more and more people getting involved And if the new group that Tina and others were talking about, and the Prosperity Network and others, or not Prosperity, but I'm sorry, the other group that Ryan was talking about, also want to step up and provide services for the community, that's great. The more they can be out there helping, I think that's a wonderful thing. But, you know, I think we've talked about this. We have some closed session items. I would make a motion to support staff's recommendation.
All right, is there a second?
I'll second.
Okay, and I did have Supervisor Bohn's hand up, so we've got a motion, a second, and Supervisor Bohn.
Just because I was back there, Betty was in business and had done everything almost close to 17 years before she ever asked for any money got any money from the government. She did it all on her own, with help from a few friends. And that was back when the city of Eureka was suing her, and somebody very close to her helped pay for a lawyer to get that taken care of. So she wasn't always the most popular thing in the world. So, and she did it through perseverance, but she had the knowledge because she lived it. So much like they said, one of the cooperations. So, I mean, if that's going to be but she went 18, 19 years. And then much to the help of back then, I think it may have been it was Phil. It was only probably 5 years ago she got her first money from the county, because they found out they got their most bang from the buck from her, and they got results. So I appreciate you for noticing that.
We've got a motion, a second. Thank you, Supervisor Bohn, for those comments. I did want to ask staff, you know, we heard a couple of times from the commenters about performance standards. We heard earlier that it's fairly strict. So I don't know if there's a way to delineate what some of those performance factors, standards are, but I know that they do exist. But I'm just curious if you can rattle off a few, because it's not with, they're no, how do I say it? There are strings attached.
Oh, yes. My goodness, with this funding in particular. If you look at section 23 in the contract, it's titled Compliance with Applicable Laws, Regulations, and Standards. So that section incorporates a lot of documents that are not contained in the contract itself, including our contract with the state, just all of the ESG requirements, which, you know, the reporting involves, they're going to be required to document every single contact that they make with an unsheltered individual. So that just includes the date, the living situation. They have to collect a number of data on the data elements on the person at intake and at exit. So they will be, you know, we're looking at the extent to which they're able to move people from the streets off of the streets. That's considered a success. You know, if you can get people to accept shelter, which many people are reluctant to accept, and certainly if you can get them into permanent housing. Those are the goals. It's really hard out there in terms of both shelter and housing. So we don't have any, I haven't set any specific targets for them. This is also very difficult because every homeless person is unique, and, you know, they're not widgets on an assembly line. So to say, you know, they're going to hit 50% permanent housing or whatever is just not realistic for this type of project.
Okay, thank you, Robert. And I did want to there's a person that has their hand up from the public, but we did close public comment. So I'm sorry about that. You know, their hand wasn't raised at the time, so I do apologize, but our standard practice to not go back to public comment. So we have an emotion and a motion. Maybe we have a motion that's been seconded, and we've had discussion. Are we ready to vote? Okay, Tracy, I think so.
Supervisor Wilson?
Yes. Yes.
Supervisor Madrone?
Yes.
Supervisor Bohn?
Yeah.
Supervisor Bass?
Yes.
And Supervisor Bushnell?
Yes.
Passes 5-0.
Thank you. And thank you, Robert, for sticking with us, even though we know you were doing your work at the same time. But I think it was a good opportunity for us to get more information, and maybe we can have a presentation sometime before the next funding comes out so we kind of know what's coming potentially. All right. I think we're at closed session now. We have one time set that we blew by. So I'd like to go to our County Council Billingsley to brief us on closed session.
Thank you, Chair. It's the intention of the board to meet in closed session on 2 items. The first is a conference with labor negotiator pursuant to Government Code 54957.6 to meet in closed session to review the county's position and instruct its designated negotiators, Kelly Barnes, Alicia Hayes, and Jack Hughes, for the groups listed in the closed session notice. The second is a conference with legal counsel pursuant to Government Code 54956.9D1 to discuss existing litigation in the case of Hess versus County of Humboldt, case number CV 21-00894.
All right, and I will go to the public. Is there anyone in public wanting to talk on this closed session item? Closed session. I do not see any hands up, so we'll adjourn to closed session. When do you think we may be out to report? A general guess.
Chair, I would guess probably around an hour.
Okay. We'll do our best. See you on the other Zoom. Oh, Tracy, are you ready?
Yes, thank you, Chair.
Thank you, Chair. On item L2, there's no reportable action. On item M1, the board voted 4-0 with Supervisor Bohn absent to authorize the Director of HR Risk Manager to enter into an agreement with the Mitchell Bristow firm for defense of the case.
All right, thank you. And with that, we are adjourned.